Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. And welcome to this first expert meeting on food consumption data for the Arab region. We're delighted to have so many of you here present at this meeting. I think actually we're going to start with an introduction of all the colleagues, participants in this meeting. Given that I have the floor, I'm going to start myself. I'm Samuel Godefroy. I'm a professor of food risk analysis and regulatory policies at Laval University in Quebec. Laval is the largest francophone university in the Americas and based, as I mentioned, in Quebec City. I have the privilege to lead a program on food regulatory science and in fact have been a contributor to the creation of the Global Food Regulatory Science Society, GFORCE, one of the organizers of this event. And also we contribute in the Arab Codex Initiative, which I will have the privilege to introduce later on. So if we can go around the table and have an introduction of everybody. And as I mentioned, this event is being broadcast live on the YouTube channel of the Global Food Regulatory Science Society. So our colleague, I think you have the microphone close, so we're going to start with you. And Maha, I'll leave you last as the chair of the meeting, if you don't mind. Okay, thank you.
So I'm Abir El-Zabin, Associate Professor from Clinical Nutrition Department, Princess Noor University.
Nice to meet you.
I'm Nahla Bawazir, Associate Professor, Clinical Nutrition, Princess Noora bint Abdurrahman University, Riyadh.
Good morning. I am Dr. Nada bin Ajiba, and I am from Morocco, and I am at the Regional Designated Center, AFRA, International Atomic Energy Atomy. Thank you.
Nice to meet you, and thank you for being here.
Hello, I'm Dr. Dalal Al-Kazemi, and I'm Associate Professor from the Department of Food Science and Nutrition in Kuwait University. I'm a McGill graduate as well. I got my master's and PhD from McGill, and my specialty is nutritional epidemiology.
Good morning, this is Dr. Tiba. I'm medical doctor, master in public health and specialized in nutrition, currently lecturer in medical school.
From Iraq. Okay, yes. So.
Good morning, I'm Dr. Hassanain, Associate Professor of Public Health and Nutrition from Al Bayan University from Iraq.
Okay, thank you. And given that the microphone is already in the other side, so we're going to move there.
I'm Khulud Bukhari, Associate Professor from Clinical Nutrition Department, Taiba University in Medina, Saudi Arabia.
Good morning, I am Dr. Sabika Al-Lahdan, Assistant Professor of Human Nutrition and Dietetics from University of Bahrain.
Good morning, I'm Fatma Al-Ma'mari, dietitian from the Nutrition Department, Ministry of Health, Oman.
I am Dr. Amna Al-Ajmi from Department of Nutrition in Oman. Just recently graduated from Master of Public Health.
I'm Dr. Salim Al-Ma'mari, Director of Nutrition Department in the Ministry of Health. I'm basically a family physician, consultant, and very much interested in research in nutrition.
Thank you so much for inviting me. Halima Al-Sabbah, Abu Dhabi University, Associate Professor in Public Health and Nutrition.
Good morning, Rima Tayyim from Qatar University, Human Nutrition Department from Qatar.
Okay. Good morning, Layal Kara, Associate Professor of Food Safety and the Coordinator of the Food Safety Program at Qatar University. I'm also a lead instructor to deliver the FDA recognized curriculum for food safety.
Thank you. And last but not least, Dr. Maha. I'm gonna it's okay. Here we go.
Maha Hdaid, Professor of Nutrition, Lebanese University and National Council for Scientific Research. And I would like to welcome you all and to thank you all for accepting to be part of this initiative, which is a very important step done by Samuel. I would like to thank Samuel and also Eli, the last minute man. I know very well that this is a project that is a regional project that is called to feed into a larger project, which is the Arab Food Standard Initiative. Samuel he will explain more to us about this concept. Thank you.
Koweït, c'est ça. En fait, je voulais justement, I wanted to actually kind of make sure, and I got the McGill part, but you see, I missed the Kuwait part.
Somewhere we have also Palestine.
Palestine as well.
He's not available with us, but then we have Jordan.
And Jordan, okay.
Dr. Rima Tayyum will be handling
Jordan as well. So actually, Dr. Rima is handling Qatar and Jordan at the same time. That's.
We can add more research as well.
We have Egypt also.
Of course, yes.
Yeah.
So.
And also we will include Tunisia and Algeria.
Okay, hopefully we'll get all the experts in the in upcoming discussions, inshallah. I just actually wanted to put here quickly the list of countries that are represented, which, mashallah, yani, represents a good set of the Arab region. And I think with the diversity also of the diets, I think we are almost representing the entire Arab region. You know, like there's the Maghreb, the Levant, the Gulf countries. So we have a good diversity here. Once again, I would like to acknowledge Dr. Maha Hotait, effort and leadership. And I'm just actually really for the anecdote to tell you how all this came together.
From Australia to Quebec.
Yes, exactly. I think what happened was Dr. Maha was visiting, in fact, Laval University as part of of an organized tour with the Francophone, the Association of Francophone Universities. And she happened to be within the platform of food risk analysis and regulatory excellence at Laval University. So within the Institute of Nutrition and Functional Food in Laval. And in fact, at that time, we were welcoming another scientist from Lebanon, Dr. André Khouri, and I guess the connection happened at that point. I happened to be out of the country on a mission at that time, but nonetheless, we managed to connect, I guess, from both sides of the Pacific at the time. And all this came together very quickly. And this is really where I would like now to start introducing a little bit setting the scene really for the discussion that is about to take place, giving you a little bit the background of the initiative, and before really getting into the technical discussions for which you are going to be the leaders. So briefly, we are organizing this activity as part of a number of larger initiatives that are collaborative initiatives. And I'm going to also acknowledge, of course, the funding sources and the various contributors to this initiative, amongst which the Arab Codex Initiative. So the Arab Codex Initiative is a capacity building program that is funded by the US Department of Agriculture, the Codex Office of the US Department of Agriculture. It is a multi-year initiative that we have been delivering now for at least a couple of years. I think we are about to enter our third year of delivery. And we have been delivering this out of Laval University, the Institute of Nutrition and Functional Food, the Global Food Regulatory Science Society, but with partnerships. And the partnerships are essentially Arab institutions, and the most important, in fact, two Arab institutions. One is regional, the other one is sub-regional. The Arab Industrial Development Standardization and Mining Organization, ETSMO. So that's basically, in other words, the Arab Standardization Organization. So we can call it that because they have many functions, amongst which standardization function, and that's why we consider them as our partners. And within the GCC, we have also a partner in the GSO, so the Gulf Cooperation Council Standardization Organization is also a partner in this endeavor. And to help us in the delivery of the program, Land O'Lakes Venture 37, which is another non-for-profit organization based in the United States, is also our partner in the delivery. So all these teams are, of course, partnering with Codex programs in the countries of the League of Arab States. So essentially, our partners or counterparts are all countries that are members of the League of Arab States. Our objectives are the following. So we aim to enhance Codex programs in the Arab region. And as you know, I don't need to introduce Codex to you. It's the International Food Standard Setting Forum. And what we would like is basically that the Arab region be better represented, be stronger in its positions, in its participation and its leadership in the Codex, or the International Standard Setting Program. We're hoping also to enhance coordination efforts between various countries. And as you know, coordination happens at various levels. First of all, most of the Arab countries are part of one, what we call a coordinating committee under FAO-WHO. It's the FAO-WHO Codex Coordinating Committee for the Near East, which actually encompasses most of the countries of the Arab region, but includes also Iran as another partner or member in the coordinating committee. Now, one country is not part of CC Near East, and that's Morocco. Morocco is in fact part of the, actually Morocco and Mauritania, I believe, both are part of CC Africa. Somalia, I believe, as well, and Djibouti are part of CC Africa. They're still members of the Arab Codex Initiative, amongst other things. Now, we're trying not to make, in fact, we're trying to encompass and include everybody in our activities, as long as a country is a member of the League of Arab States and particularly member of ETSMO, they are in fact part of the initiative. ETSMO is in fact taking the leadership in the coordination activities, and in fact we have an Arab Codex coordinator that is based in Rabat, Morocco, where essentially the headquarters of ETSMO is based. So I mentioned leadership, but we are also looking at building the foundations of Codex participation, because when you do the analysis as to why countries are not so present or are not so actively participating in Codex activities, you will identify that it's stemming from some weaknesses in the food control systems or some gaps in the food control systems. So we cannot enhance Codex capacities without addressing those. Amongst those, of course, the capacity in risk analysis, in risk assessments, and in the foundations of those. Which is essentially exposure assessment, and of course now from there I'm coming to the food consumption data use and analysis. Now this is practically the same slide, representing our activities in Arabic. We're trying really, we have a number of initiatives underway. So Dr. Maha mentioned the Arab Food Standards Initiative. So out of our Codex activities, what we are trying to build right now, we're trying to build a program aiming to practically refound horizontal standards for the Arab region. When I say horizontal standards, it's essentially the capacity to come up with decisions related to food additives, contaminants, labeling, methods of analysis, nutrition, and food for special dietary uses, and so on and so forth. And again, we cannot build such a program without having the underpinning capacity, again, the capacity for risk analysis, occurrence information, and consumption data. So now, of course, I mentioned GFORCE as one of the contributors, and here I'm going to say a few words, if you allow me, of what GFORCE is and what it's trying to do. The Global Food Regulatory Science Society is a young non-for-profit organization, also created in Canada, so based in Quebec, in fact in Laval University. And we were created as a result of a realization that a particular field of food science, which we call now food regulatory science, so essentially any scientific discipline that underpins a regulatory decision, this particular field was not covered by a home in the form of a non-for-profit, for example, body. Food science, as you know, has a home at the global level, which is the International Union of Food Science and Technologies, IUFOST, okay? So, in fact, we aimed at creating GFORCE to fill that gap. And the objective is, of course, we know that every country that is member of WTO, the World Trade Organization, has to adhere to two agreements, at least of WTO, the Sanitary and Phytosanitary Agreement and the Technical Barrier to Trade Agreement, which essentially what they call for, no country can make a decision of a regulatory nature that touches on a sanitary aspect, including food safety or nutrition, or even of a technical nature unless it is evidence-based. And for sanitary decisions, it has to be based on risk analysis and risk assessment in particular. So being able to build capacities of risk analysis is one of the key elements that we wanted to address in terms of gaps. So hence the creation of G-Force. What we want to do, promote the generation and dissemination of knowledge and competencies related to food regulatory science. And you have there a definition of what we mean by food regulatory science. So you see, capacity building, competencies, data generation and dissemination. We aim to work for the public good, which means that nothing that is developed by the organization is meant to be owned by the organization. It's meant to be really owned by the collective. It's aimed to be made public, shared, and that's why an event such as this one and an expert meeting such as this one is being broadcast live and actually shared with the scientific community overall. From a legal standpoint, we are a non-for-profit, as I mentioned, organization that was incorporated under the laws of the Confederation of Canada, based in Quebec, in Canada. And again, the whole thing really started with discussions that took place on the margins of food safety events, in fact, in this region, in the UAE, in Dubai, where we identified, in fact, the need to create this organization and moved ahead with this creation in 2020. These are some of our members. I'm going to actually, I'm going to spare you the video because you will be able to see it, so I will spare you the video. Just actually to acknowledge a couple of our board members and founders, founding members. Professor Jianqi Chen, and I don't know if you've had to meet with Professor Chen. Professor Chen is a member of the Academy of Science in China. I could say, one of the fathers of the modernization of the food safety systems in China. Since the various crises, and making probably China right now one of the leading jurisdictions in food safety regulations. Dr. Pamela Byrne, who is the current CEO of the Food Safety Authority in Ireland. Dr. Scott Crerar, former science manager in FSANZ, in Food Standards Australia and New Zealand. Nuri Grass, who used to be so she's the former Secretary General of ACHIPIA, which is the Agency of Food Safety in Chile. So, and I'm not mentioning many colleagues. In fact, many of the colleagues are from the Arab region. Hence, in fact, so colleagues from Morocco, from Tunisia, from Lebanon, hence the focus initially to create or to deliver capacity building programs in the region, in the Arab region in particular. So some of the areas of intervention, data generation and dissemination, risk assessment capacity development, and we have identified that one of the key gaps is the ability to deliver risk assessment activities in the Arab region. When you look at the food control systems in the Arab region, the risk assessors are really a rare, I would say, I'm not going to say commodity, but a rare set of expertise that you can find in the Arab region. And we want to invest in making that available more and more with the corresponding level of training, but also with the corresponding level of data. Codex, and supporting to Codex initiatives as part of the Arab Codex initiative. So in fact, just to mention, we do not intervene only in the Arab region. So we have also a contribution, particularly through the Codex initiative in Asia, with a specific attention to the Southeast Asian area. Also in the Southwest Pacific, so essentially the Pacific Island countries, of the Southwest Pacific. Of course, this is being delivered also in collaboration with the governments of Australia and New Zealand. We're also contributing to food laboratory science, and in fact, we are part of the AOAC endeavor. You may have heard of AOAC International. That's another standardization organization, but a non-for-profit based in the United States, but encompassing thousands of countries. It was created in 1886, so it gives you an idea about how anchored the organization is in the food analytical community. So here we are, in fact, hosting the Arab section of AOAC International, and we are currently building the Southwest Pacific section of AOAC International. Again, building this community of practice and community of scientists in this particular field. Also training in food regulatory policies, and where possible, and we will probably encounter it in this project, trying to contribute to the availability of information and communication technologies, so essentially what would help us deliver the various activities that we are part of. So, now, clearly, what we're trying to do is to have a contribution to the risk analysis paradigm, insisting on this particular bubble, the risk assessment bubble. And more specifically, in the risk assessment bubble, as we know, hazard characterization tends to be covered by international programs. You can get access to outputs of hazard characterization through JECFA, GEMRA, JMPR, so the FAO, WHO advisory bodies to Codex. Exposure, however, tends to be a country or region-specific area. And we cannot make regulatory decisions, we cannot even define the suitability of a Codex standard to our own jurisdictions unless we are able to do this particular assessment of exposure, which brings us really, again, trying to do the exposure. We're looking at the amount of foods in a very simplistic way that is consumed, looking at the occurrence data, the occurrence information, taking into account the body weight, and trying to determine the intake, and then verifying that level of intake vis-a-vis particularly a health-based guidance value that is established through the hazard characterization. This part is not available in many countries and is not covered by many countries, and that's what we are trying to invest in specifically. We're trying to invest in making available information on occurrence of chemicals in food. We're also trying to make available data related to food consumption. But here I would like to be specific. We would like to make available this data such that it is used by regulators and risk assessors. And in fact, this was our great surprise to identify that you have been working in the Arab region for so many years on this, yet the information and the data that you generated is not necessarily accessible. It is probably accessible, but not necessarily known to those who are so much in need to use it. And again, the community of users, I mentioned regulators, but I also would like to mention industry. How can we expect food industry to make an application to a food regulator requesting the authorization of access to market for a food additive or a novel food, for example, or a packaging formulation, unless you are able to demonstrate the safety of that product? And how can you demonstrate the safety of the product without actually having access to an exposure assessment and using consumption data? So this brings me really now to the objectives of this initiative, which was shared with you, I hope, through a document that I know, disseminated a little bit short notice, but it tries to really summarize what the Arab Food Consumption Data Initiative aims for. Unfortunately, like the slide was a little bit cut here, so I'm just going to try to adjust it. I had just a formatting issue so that it becomes a little bit more readable. Give me more few seconds here to adjust that. No, I'm not. I'm doing worse, I think. Thank you for that. So basically what we're aiming for is to create reliable repositories for food consumption data that are representative of the Arab region, including country-related data. So we are targeting country-related data as well as regional-related data. What we would like is that this data to become available, usable by regulators and their stakeholders. So, and the industry, for example, or even consumer organizations, if they so wish to make an evaluation. We would like to develop with you agreed upon methodologies for food consumption data collection. Again, the idea is that we would like to create consistency in the way these methods are developed and deployed for those who wish to start generating this type of data. We would like to develop and maintain the set of enabling tools, including ICTs, so information and communication technologies, supporting the consistent deployment. So for example, if a country wants to go on the field and start collecting information, they would be so much helped if there is an ICT in the form of an app where essentially the information is collected, consistently and easily. It will decrease the costs in a tremendous fashion. So if these things become a public good and accessible, it will decrease the cost tremendously. Just to give you an anecdote, as a former regulator, I have had the privilege to serve as a regulator with the Government of Canada for about 20 years. And we used to, of course, we needed consumption surveys, and in fact, we stayed about 20 years without a consumption survey that was, updated. So when we looked at, in fact, generating the latest version of our consumption survey in 2015, it cost approximately $3 million. There's no way that we can expect developing countries to invest that level of funding in order to get such crucial information. And that's why I think we have to be, as a community of experts, creative in the ways that we want to have reliable, we want to have, trustworthy data, usable for the purposes, but we want it also to be accessible in a cheap manner. You see that what we're trying to get at. We want to also develop training, capacity building material to disseminate this knowledge, and again, adoption of these consistent and harmonized methods supporting food consumption data collection in the region. Whatever we do here might have a lot of ramifications elsewhere in other regions of the world where the same need is expressed. And of course, we're starting with you. You are a community of experts. We would like to grow this network of experts and to grow it by creating really opportunities of meeting, of supporting any type of research activities that you might have, of course, in alignment with what we are able to offer in terms of the initiatives that we are delivering. And I promise this is my last slide. So this is really, again, to set the stage for what we would like to achieve today. So it's not the first time that we talk. We had a chance to have a very brief call, and that's how we discovered, in fact, that you were all meeting here in Doha, thanks to an organization, I guess. I don't know who is at the leadership level. So colleagues from Qatar University, thank you, absolutely. Thank you to Qatar University for bringing everybody together as part of the pediatric nutrition, I guess, conference that you had. So, we would have been really it would have been a total remiss if we did not, leverage your participation in this same place at the same time and actually get together in order to get this project in motion. So we're very lucky, and I'm considering that as a sign from God, from destiny, that this is probably going to be helped, in the implementation. So this first meeting, we would like to continue the discussion, because I know you started it, on mapping current activities supporting food consumption data collection in the Arab region. So many data apparently is available. So many studies have been already done, some of which might be at the stage of being updated, perhaps. So we will need to know what is there, and we would like to contribute to the mapping. And why not publish that mapping, make it available so that we know what is out there. But what we would like to do is that out of this, the outputs of the data, we would like to see how can we make it available? What are the ways to create this repository of data that becomes accessible? What would it take? What do we need to invest, in order to make that? Apparently some is accessible already, but how, etc., that's what we need to discuss a little bit. And then what we would like is basically chart a path forward. And mostly, we would like to see how can we have consistent or harmonized guidance for these key surveys that are the source of the data. So the 24-hour recall, the food frequency questionnaires, which are again, this is the gold standard, particularly the 24-hour recall for collecting the data, and that's what we want. We want individual data that are representative and giving us information on individuals with gender, age, that gives us really the information that we need, particularly for probabilistic assessment. But we would like also to think of surrogate information. In some cases, that might take place to be generated and developed. How can we get that? Can we get surrogate information and how we can use that? By the way, we organized a webinar to which Dr. Maha contributed back, I'm trying to remember now, in October, was it? Or November? November, I guess, or yes. Yeah, no, actually even December, I think. It was during a Food Africa meeting. Anyway, the days, go by so quickly, but we had a webinar where we discussed a little bit the surrogate data, and in fact, we set the stage for the possibility of discussions such as this one, but we are glad that it's happening so quickly. So this is what we would like to do. And right now, my part is actually done. And now, yeah, definitely now it's your part. If you have any questions, and then I'm going to give you the floor.
Can you elaborate a little bit? What do you mean by surrogate?
Okay, so surrogate data would be something that gives us access to information about consumption, but it's not consumption data. So the example that we are actually thinking to promote more, because it's the closest to something that is most usable for probabilistic assessments. We know that every country has a statistical study looking at what every household spends. So essentially the budget, the household budget surveys. Every statistical department in every country at whatever level of development has that. And generally, this data is at the household level. So you have individual data points, which means that you can do, assessments with individual data. So you can do, probabilistic assessments. Now, the issues that we have is we try to access the data or the expenditures related to food for a household. There are methods of conversions that are out there, and in fact, we made a lecture. My colleague, Dr. Silvia Dominguez, actually presented this at the last webinar that we introduced. You can convert the information from dollars into grams of food by household or even by an adult equivalent level. So we try to actually transfer it to adult equivalent. The issue is we don't have gender, we don't have age. So this is the two pieces that we lose. But we are having something that is better than a very general representation giving me an average number, which actually would not even allow me to look at percentiles or to look at, high consumers and so on. So it's still much better than some alternatives. So this is an example of surrogate information. If we can have the little microphone, or can you hear with the, just for, oh, yeah, so that the mic stays here. So sorry, thank you. Here we go.
Thank you for this initiative. So my question is very brief. Is your objective to do only probabilistic risk assessment, or you will do both probabilistic and deterministic based on the available data?
So we would like to make available the information for risk assessors such that they conduct the exposure assessment that they wish. Now, of course, deterministic is the easiest or the most accessible that you can get to, but we know that deterministic gives you, of course, some approximations. You can do worst case scenarios, etc. We would like, and again, deterministic assessments, you can access some data like averages or high consumption levels. So individual, consumption points can give you that information. What we know that the biggest gap is for probabilistic assessments, And this is where the individual data points and actually the characterization of consumption with the surveys that you generate would help mostly. Probabilistic, we know, gives us the better representation of what the situation is and allows, therefore, for risk management to become more realistic, even though we want, of course, to consider worst-case scenarios. With that, Maha and colleagues, the floor is yours now, and you can manage the agenda.
You already informed us a lot, and I think the colleagues are now aware of all the steps and the objective of this initiative. We already made a kind of summary. And I sent it to you in the morning at 3 a.m. I think, and it contains everything that was done in your countries. And overall, we can see that around 8 individual food consumption survey in the Arab region was conducted, of which Bahrain, I think still missed. We didn't access the article or the data, so it will be a total of 7 only. So it's a new step for us to enter in this new project, and I want from you to have. I want your feedback or your input on this actions or this research we did, because based on this we will start calculating the sample sizes for your countries, and we have our team who will be ready to help in any step concerning mainly the 24-hour recall, the automated multiple pass method. And we will talk deeply, inshallah, Kamena, in our next meeting concerning the global diet, and also what is the best tool to use, because 90% we will not be using the food frequency questionnaire, because there is no food frequency questionnaire that is common for all of us. Despite that, unfortunately, the FFQ is represent more the food groups and the food ingredients, but the 24-hour recall is also a good tool to be used and more easy to administer. Yeah.
So I was saying that the food frequency questionnaire represents more than habitual intake.
Yeah.
The 24-hour report can be biased by what is the person eating now or constant season or eventual occasion. So, one 24-hour report is never representative of actual.
We will be taking 3 24 hours non-consecutive days. For example, Monday, Thursday, and a weekend day, which is for Saturday or Sunday. Okay, and based on this, we will have the sum. We already did the food consumption survey in Lebanon, and we thought that it's better to use the 24-hour recall. The FFQ is not easy, especially that if you want to cover all the traditional dishes and things that is related to your countries or food related to your countries. So the 24-hour recall will be common for all of us, and the analysis is easy also.
And it should be like electronic. It can be electronic and multiple pass.
We will be using this. Yeah. Yeah.
Does it work?
The sample size, we cover all the missing food items.
Yeah.
So the more the big sample size, you can cover more.
That's why we need to have information concerning the geography, distribution according to geography or geographical distribution, to know per governorate, per district, how we will do the data collection, how we will think that this is the minimum representative sample size per each district, governorate, etc. So we need this information from you. I already talked with Dr. Rima. Dr. Rima, if you have any input, يعني, you are expert in this field also.
Okay, thank you very much, Dr. And Dr. Maha and all colleagues and Dr. Samuel. I have an idea to develop like a qualitative food frequency, qualitative, not quantitative, for the whole countries, with the main foods shared in the whole countries, like rice, bread. So we will have like a qualitative for the food groups, and then we will go using the 24-hour recalls. And sometimes, from my experience, maybe the first one will be face-to-face, but the second and third one could be over the phone.
Like the
And
Anheuser study.
also, sometimes we cannot, if we just get two 24-hour recall, we can also consider this 24-hour recall, because not all the people will come back to the third one. Some of them, they will not answer your the phone. Your call will not be answered. So I think as much as we have sample size, we can go for two. If in some cases we are not able to get the third one.
Okay. First, I would like to highlight that maybe Samuel, you want to inform us more about the age categories. Maybe it's better to start by the adults, right?
I mean, if we are doing the surveys, we would like to capture what is in a household.
Okay.
So we would not want to have, because otherwise, the work will have to be redone.
Yeah.
So to the extent possible, it's again. I mean, you are the expert, so you tell me. I mean, I'm going to tell you my wish list as a risk analyst, let's say. Okay, risk assessor and risk manager. If it's possible to capture what happens in a household, including the composition of a household depending on the ages and the genders that are representative, that's what we would like. That are represented, that's what we would like to capture.
Okay.
When we do risk assessments, and particularly exposure assessments, we do not wish generally to do an adult and say, you know what, we're going to do the children one in 3 years. It's really, we will have a problem doing that from a regulatory standpoint.
So one adult, one child.
If there is basically whatever is represented in the household in the best way possible. So
One male adult, one
female adult, if we can. If we can, one child, yeah. Well, if they are there.
One child, female.
If they are represented, yes. If they are represented in there. So not that we have to capture everybody in the household. So whomever volunteers in that household, to be there. So, and I don't know, methodologically speaking, if that works or not. So maybe in one household, you have only one adult female that will contribute. In another household, you will have maybe the male, and you will have the capture of the information for the young girl. You see? And it's after that, it's the collection of all that we will put together and we will try to use in terms of the distribution of consumption of the various commodities.
Before in Palestine, we worked in a national survey, for example, for household. So we took the head of the household, plus the any child under 5, and the female who is also in the teenager age. Yeah, but my question now, thank you very much for this initiative. It's a great initiative, and to gather together all Arab countries here. Really, it will be a very good future for everybody. My question is regarding the fund and the budget for this, because it's a huge project. So because before we started, put all these hopes and wishes, and we need to know more about this budget and grants.
We'll be very transparent with you.
Thank you.
About that. So let's put it this way. And that's why, in fact, in the way we framed the discussion first, let's see what you have. Let's see what is available first, because before starting investing, and we know, I told you, I'm totally cognizant of how much it can cost. And we cannot afford that cost. So let's be very clear. I do not have $3 million for food consumption data to one country. That's not possible, that's for sure. So in terms of budgets right now, we are leveraging various initiatives. as part of the Arab Codex initiative, we got an agreement that some of the funding that is available will, and when I say some, we didn't actually quantify it. So right now, it's initiative based. So essentially the way I do it, and I can tell you, like for example, for this meeting, we had this meeting as an initiative, one-off initiative, to be based, and I guess I had a very good justification. You were all here. So, you know, putting this, I would consider very modest investment to bring us all together and in order to have this discussion is a very worthwhile investment. So I'm just giving you sort of the way we are functioning. We have big ambitions. We know that the scale is big, but we are functioning step by step. And we are functioning also in a manner that we will leverage every source of funding that may be available. The one that I know of, and that is sure right now, is the Arab Codex Initiative has agreed through the funding source, that is the US Department of Agriculture, US Codex Office, has agreed to dedicate some of the funding to be determined to activities helping us get the data. And this is stemming from the acknowledgement that there is no way Arab countries will be effective in developing codex positions unless they have access to such data. Okay, so that's why, like, we have. So here again, I'm not going to give you the scale, but I can give you that the Arab Codex Initiative is a multi-year, multi-million-dollar initiative that is being implemented with the partnership of ETSMO and the GSO. So, but again, it's not dedicated to consumption. It's dedicated to codex activity. So there's that. Just to finish, on the way we're doing that, we actually opened also a call for funding. And we are actually working in the most, I would say, creative way, if I may call it that way, possible. Meaning that we are opening a call for funding to all stakeholders. One of the sources of funding is, in fact, a trust fund that we have created within Laval University dedicated to food regulatory science. And this trust fund receives right now a number of contributions from partners, and we have some funding available that we can use in that regard. G-Force has also some self-funding mechanisms, and again with the agreement of the board, and that's why I'm saying initiative by initiative basis. Yeah. So essentially, like, the way we'll do it is for milestone X, like, I don't know, mapping of the existing data, extracting the existing data and making it available in here. So you see, like, we want to have tangible milestones that we know will lead us to a deliverable that we can touch and that can, when I say touch, meaning it can advance us to the next step. We will dedicate some funding in that fashion, with the idea, though, that our vision is broader, our vision is big. This also includes support, again, if we identify that there is an initial investment in some of, sort of an inception stage of the survey that will be developed at some point in a particular area, we might fund the academic institution that will be doing that and the academic team that will be doing that. So that's how we are proceeding. And I'm being very transparent. I wish I could answer is, I have this bag of money and I'm ready to distribute, but it's not our reality. So.
Okay, while you mentioned these bodies that can support us, when applying for a grant through university, which is a possibility, it becomes very sensitive issue who would be the PI and then who is added to the project, and there is a limit. And seeing that it's a big group of researchers, probably I cannot add everyone, so I have these limitations as an academic researcher. And then if I want to partner with food businesses, how sensitive is this? Is it possible? Do you allow it? So there's a conflict of interest and things like that. So could you please advise on that?
So again, we're totally acknowledging all the limitations that every academic funding may have. I'm an academic myself, and I have also these type of limitations. Now, I guess our guiding direction, if you will, or principles are really the guiding values of Codex. We want this project to be like the values of Codex and the organization like GeForce and our platform and so on. Transparency, we want everything to be transparent. Inclusivity, we don't want to exclude anybody. So essentially, I'm going to tell you, I will not be shy to take money from industry if industry is willing to give money to an initiative such as this one. At the end of the day, they're not going to be taking direct advantage out of it. I think what industry would be interested in, any member of the industry is interested in a predictable food regulatory landscape. To get a predictable food regulatory landscape, you have to have decisions based on science. You have to have decisions based on data because you cannot do the scientific assessment without that. So a lot of the industry groups that I've had the chance to discuss with are absolutely convinced about this, and some of them have already expressed interest to fund. And in fact, we're not excluding to receive their fund. Now, at the same time, we're not going to be limited to their fund. So that's the thing. So, in fact, I think what makes potentially this a special endeavor is that we are multi-partner, multi-initiative, project, if you will call it, and we are ready to leverage everything. So if you have a program already, like you apply to an academic fund, you receive the fund, and your funding allows you to share the data with what you have, but then you need maybe an additional study or an additional add-on that will contribute, that will allow us to access to some of the objectives that we want to get, but that could be a contribution, an additional contribution. At the end of the day, what we did is we leveraged what you got, which is probably tremendous because you have the credit for it. But at the same time, we helped generate a public good with the additional funding that we may have contributed with. So you see, this is the way we see things. We know that for every dollar, that was invested in this meeting, I'm expecting probably 10 to 20 more being generated as a result of putting together this level of expertise and this network. I'm convinced of that. So that's essentially what we're going to try to do, is really to leverage what is out there. And in fact, given that also we're broadcasting this live, and I'm hoping that it's going to be watched by a number of colleagues and a number of funding sources, I am renewing the plea for funding for an initiative such as this one. And believe me, I will spare no effort with you all to be able to secure that funding. I think it's feasible. It's achievable.
Sorry? Oh. Okay. First of all, thank you so much for the invitation, especially to Dr. Maha. I have 2 points. The first one is about the 24-hour data recall. Because I have experience with 24-hour data recall, we have a problem with the measurement, especially when we go to the general public. When they say we eat 1 cup of rice, for each one, the measure of the cup is different from one family to other family. So at the end, we take our our stuff with us, and to show them, can you measure? There is 3 measures of the cup. Which cup you mean? Yeah.
There is food models.
Yeah.
We can share with you. Also, we have NewMed in Lebanon, which is a company that sell products that help you filling the 24-hour recall.
We don't have this in Iraq yet.
We will send it to you. I will talk to my partners.
Only in Lebanon? Yes.
Yeah,
oh, okay, that's good.
And there is also Food Atlas. Yeah. I think you have per countries, you have Food Atlas also.
Because in Iraq even dietary
guidelines. We will be sharing this data with you.
So I think that's the difference between FFQ and the 24 dietary recalls.
The FFQ is not easy to administer, and I know Samuel was discussing the importance of collecting data by household, which is a little bit challenging.
Very difficult.
So maybe if we want to cover the big numbers of households, it's better to stick on individuals, and in this way each person will be representing his household in this way. So this is what we did in Lebanon, and we have around 3,900 person or household,
because that was
representative sample size.
My second point, because I was talking about the household, because if you talk about Iraq, we have 18 governorate and a population of 45 million now. So it is impossible to cover household level. It is, yeah. So I agree with Dr. Maha. We go with individual is better.
Food consumption.
And also I agree with Dr. Rima about the 2 days, because in Malaysia for 24-hour data recall, we take 1 weekday, 1 weekend.
Okay.
So it will be more representative 24-hour data recall. Two. 1 weekday, 1 weekend. Yeah. So this.
It's based on individual, on one person per one household. In other household.
Can I just comment regarding household?
And usually, the mothers who will be reporting for their children, they will be both recruited from same household. This is what we did in Lebanon. According to the European Food Safety, the EFSA, they did the same methodology. So we followed the same. So I think I invite you, and I will send you the report and the review of the European Food Safety Authority methodology of doing the individual food consumption survey, similar to that done in Lebanon. In this way, usually the children and the mother from same household, and the adults, a male from other household, and the elderly also, and the adolescent also, depending on availability of adolescent per household. This is what was done in Europe.
Can I just comment regarding household, because I had a project at the level of the households where we wanted to assess the most frequent local and traditional foods consumed in Saudi Arabia, in different region in Saudi Arabia. It was really challenging. This is one thing, and we had the idea to take like one male, one female from the same house, but at the end we found that they are eating the similar things. They share the same things, yani mostly.
This is
so
not
why?
showing the exposure.
Yeah, this is one thing. The other thing, to make it easy and to recruit more patients, I would suggest to have a bigger sample size when one day, instead of taking 3 days or 2 days from the same person. But I think, and we need to recruit for the whole weekdays. I mean, we need the recruitment every day, like even during the weekend. This is the way that we can catch the weekends. So getting back to the same person, I don't think so even. It will be easy.
Okay, but
just I have a comment on one thing. If you have a homogeneous sample, so we did it in Jordan. We have Sharkas and Shishan, so they are closed communities. So we did it as one because they have the same food. But I think in Gulf, especially in Gulf, we have different cultures. So one day I think we'll
it's not represented.
Yes. I don't know if we will make it just for the country nationality, for Qatari people, or any people living in Qatar.
Yes.
So it will affect the yes.
Depending on the origin.
And maybe
like
this
yours.
day is not
And
as usual.
And I think actually here you started discussing, like true experts, you started discussing methodologies. It's very tough to keep you away from that, right? So if I may suggest this, because I think this is something that you can only discuss and identify what is the best path. I will not be able to really advise on anything like that. So if I may suggest, I mean, you all have conducted these. And there are learnings from each of the experiences, right? Because what we are aiming, because in fact here, you're already getting into the third objective. The third objective being the method that we would like to advise for people to follow if they want to plan something like that on an ongoing basis, right? So kind of you're jumped too fast to that one. If we can go a little bit, one step before, which is what is out there and how you did it. And what did we learn from it? Because already I can tell you that right now we are, with an empty sheet. I would take anything that you have and start populating that information in a database that my risk assessors can use. I'm going to give you... You already have that?
Yeah. We already did it, and we send it to the colleagues to have their input, and based on this, we will transform it to the kind of database to start with, using it.
So this is great because I'm going to give you a few examples that I would like to have right away. Okay, so I don't know, here in Qatar, we might be interested in looking at lead in a number of commodities that are out there. So I would like to have, the various commodities where lead is, and we know, we're going to be looking at some, food of plant origin like leafy greens and some things like that. We're going to be looking also at some, things that children consume like candies and molasses and honey and so on. Is it possible to get access to that, in the various countries, okay? In the various countries. Rice is a hugely consumed commodity in the region, okay? Particularly in basically the Levant and in the Gulf Cooperation Council countries. We're going to be doing something on arsenic in rice. We would like to have really a good representation of rice consumption. We have another example of, and I'm sharing with you now really as a risk analyst or as a Codex, contributor. Codex is looking or has already looked at a number of maximum levels for mycotoxins, aflatoxins, OTA, etc., in a number of cereal-based products. Cereal-based products are a huge number of products here. Like, we're not talking about, one type. So all the various cereal-based products. If I want to have an assessment of that in various parts of the Arab region, we would like to have access to the food commodities where cereals are the main contributor. So if we could start from there, like get the data and make it available, and probably you're going to advise us on something else that we will need, like food composition tables, or food atlases and so on.
Also, they were sent to that.
So, you see, these pieces right now are, for me, kind of unknowns. Like, I have a big question mark. I don't know, like if I ask one of my exposure assessors tomorrow, do this, they would not know where to go.
Being in the field for a while, I feel a bit that we're going backward because there is lots of literature already that critiqued the 24-hour recall on risk assessment, for example. You mentioned a very good example, like the grains. If you want to study risk assessment and, for example, arsenic exposure in rice, this is something I actually looked at. You need a food frequency questionnaire. You cannot say it's just based on the 24-hour recall, because when you want that data of a possible grain consumption, it will never be captured with a 24-hour recall. So probably you need both.
And I probably agree. No, I probably agree. No, sorry, go ahead.
It's in my head.
Sorry, please.
Also, something that comes up to my mind, the burden on the respondent is huge if it comes to a food frequency. So I think, having chopping it, I think it's better to me, like as a researcher, because I understand that our first goal to look at arsenic, for example, and grains, and then look at something else, and then we can have this probabilistic recruitment in smaller project. Even for funding, for me, it makes more sense than having huge database, and then probably low response rate, not being, So I think maybe chopping it into what is the major problem in the Arabic region, then, chopping it into priorities will make the project run faster for everyone.
And actually, this allows me, by the way, to just also chart a path forward, okay? In terms of also sort of a second meeting that I would like to have, because even though I was meant to do this at the end, but I just wanted to, so it can guide our conversations.
Also, I can recruit people who can help me, for
sample and validate my measures. I mean, I could make it more nicer as data set points and give you more things to work with and more values to work with and study that biological association, relationship, finding, so it becomes more impactful for policies. So I think we should put an agenda. What is the most important things to look at? What are the issues to look at? Especially when we're dealing with Iraq, when we're dealing with Jordan, Morocco, Palestine, their exposure to chemicals, their exposure to water pollutants, their exposure to pathogenic problems, being contamination. It's different than somebody in Kuwait or Qatar or UAE and all of this. So we have to think about these things.
Absolutely, and I think actually this will be one of the areas, if I may just quickly, like one of the areas that we will be looking at in terms of prioritizing. So I will put that as a point. Just to tell you, like in terms of charting a path forward, what I'm hoping is that after this meeting, we'll have some conclusions, some directions, some recommendations, whatever that may be. I will be in your hands in terms of coming up with these. Our next milestone would be, we would like to convene, in fact, another expert meeting. Where here we will strive to make funding available to bring you, because here, we kind of, leveraged, you were all here, but we'll strive to making the funding available so that we can gather the set of expertise that we need, and for a longer period of time. So essentially here, like it's going to be really a workshop that we will strive to organize. It's going to be also in Qatar, and I will be talking to my colleagues here from Qatar University to see how we can also collaborate on this, but also with the Ministry of Public Health here in Qatar as well, given that there is a strong interest in investing in this particular area as well. And we are aiming for the second week of June so far. So just wanted to let you know. I mean, I know it's hot and warm in Qatar, but you know what? We will not be stopped by the weather, right? We have to meet wherever we need. And actually, Qatar offers us also the possibility, because we will have most likely the organization of the third Codex Colloquium. So we will have a number of food regulators coming for another meeting. So we'll try to leverage also the participation of the regulators and allow this exchange with the level of experts. But this means that we will need to accomplish some things between now and then. So you see, that's our objective. Okay, I'll stop there for the chart, the path forward.
I just have an answer to Dr. Dalal. We are meeting today having an aim to accomplish the objective of having Arab food consumption data. I know very well that Samuel also has colleagues from the food safety discipline or science. So we will be sticking to nutrition part, which is the Arab food consumption data, collecting a representative sample size of data that show how the country or the people in this country are eating. Because in second phase, and that's why we have Dr. Layal here, she's an expert in food safety discipline. So they will be handling what you suggested, because already they started doing the mycotoxin, the arsenic, and they have a lot of publication in this. So we will be in charge of doing the phase 1, which is the food consumption data. Thank you.
This way? Oh, okay. Yes, I just want to add to the point that Dr. Maha said. We are taking the second part, but I want to support your point in one thing. I'm not an expert in consumption data, but we did a study about risk assessment, mycotoxin using FFQ. And in this FFQ, we asked if there is any exceptional consumption of this specific type. And actually, the results were surprising, because many people consume the same type of food much more time, depending on season, depending to religious reason, and so on. And the risk assessment was totally different. So I know the objective here is to harmonize the method and to have something common that can be compared, but also we need to keep in mind all the limitations that we have to select the best method. increased.
It increased.
It
There is
increased over.
frequency,
So we
yeah.
asked over the year how you consume,
Yeah, that happens with
and
frequency. Right.
yeah, and we have the risk assessment was totally different. So I agree with you.
Yeah.
We might losing a lot of aspect when doing the 24-hour recall.
Yes.
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 only.
And in fact, again, as a risk assessor or as a risk analyst,
Yeah.
we would want to use whatever data that would allow us to get closer to the reality. As long as we know. So if we use one set of data, as long as we know the limitations, we will be able to comment on the data. So essentially we say, we arrived at this level of exposure, but with the caveat that this type of data that has the limitation X, Y, Z. And then basically we say that we want to address these limitations by X, Y. Now, and here, I mean, I'm going to be saying I'm going to be asking you also the potential for using data coming from different surveys. Because if we look at some regulators or some risk assessment agencies, okay, and particularly if I use the European Food Safety Authority, the European Food Safety Authority relies on consumption data coming from all European countries where these data is generated. So long that we know how the data is generated, what are the limitations of the data, we upload it, and then after that, I guess, the experts that are going to be using it will be using it with all the limitations and caveats related to that data. But I really repeat, my first thing, beyond the mapping, which I think is well underway, right now, believe me, as much as you say this is available, for me right now, this is a long reach project. I don't have it. We need to have this. And this being, we would like to have data that risk assessors use. If tomorrow I go, perhaps at the exception of colleagues in Saudi Arabia and maybe to a certain extent in Morocco, because there was some investment, maybe also Tunisia did some of that. For the regulators, if I ask a regulator tomorrow in an Arab country, let's say even in the state of Qatar, they will have a difficulty accessing the data right away ready to use for them as an exposure assessor to do the calculation. So right now, I know you're discussing, for me you're discussing, you see, I'm thinking of my Chevy, you're discussing the Cadillac already, Right now, honestly, I don't have a car. So even a bicycle, I will be okay right now.
By next month, we will have a bicycle.
So if I have a bicycle by next month, I think right now, I will have achieved the goal. Sorry.
Okay, thank you. This is very exciting discussion actually, and we start having a clear idea about what is expected from us. So while you are discussing, I'm communicating with my colleagues in Morocco to understand to what extent, that we can go into this very interesting project. Absolutely, the idea is very interesting, and there is no doubt about your convincing ways on how to bring to us the necessity to develop such a database. So I'm having one worry and one question. So my worry is we understand very much that we are going to go step by step, and on our way we like having more funds but from my perspective as a researcher, and because of the huge amount of work that we are expecting to deliver, I definitely I understand that we will need to bring up more experts, and if I consider that it has to be representative and 24-hour record, frequency questioning, it will need a huge team. And we will be having PhD students, master students, and at a certain extent, even when I'm talking to my colleague, he says that it looks like it is national, representative, so we need to bring Ministry of Health.
Of course.
It cannot just only done by the academician. So my worry is we will very much willing to demonstrate our commitment, but I'm just like afraid that why engaging in this, we don't know any how would I mention this? To what extent to what extent it's going to be bigger and bigger, and it will have like kind of how would I say, like logistic and technical consequences. So if I make it like shorter, it would be better if I have a clearer idea, because now I'm just assistant, I'm attending the meeting, but I will be briefing my people in Morocco, and they will ask me questions that I'm asking you today here. Thank you.
If you would you like to continue, Dr. Dalal, on maybe use the, if you don't mind, please.
And also with this, there is logistics also of, the ministry being, when you involve the ministry, when you involve other people, they want to take over and remove you also from. Sometimes they do that. They actually do that because it's like, then it's our project. So they take the leadership, and then you don't become the lead in the project.
Sorry, yesterday I presented my research in the conference about the food allergy, knowledge about the parents. So we collect the data in the primary health care center. For Ministry of Health to get approval to go to the primary health care center, I took 1 year. 1 year to get approval from Ministry of Health to go to the primary health care just to interview the parents. It is just a survey, a questionnaire base. We didn't check the children, we didn't take any blood sample. 1 year. So in our countries, yeah. So in our countries, the routine and to get approval of Ministry of Health, it will be impossible and very difficult. So I don't know.
I'm not going to minimize any of the challenges that you all indicated, and I'm going to be also very honest and open with you. I do not have answers to all of these challenges myself tomorrow. I wish I had a magic wand and I will be able to say, all this will be solved.
We are discussing regarding the household, how difficult it is even in the Gulf areas, because it's impossible to go for the houses. And as it is individual also one, then maybe we can do that not in the household, maybe outside the household. Maybe at in the community, outside in the class, different areas. Because in the household it will be very difficult. In addition, I'm talking about, because you are talking about the risk assessment, and we did several studies, for example, about heavy metals in, for example, the common herbs that the people consumed in UAE, like mint, parsley, and the source of planted where they grow. And we found also interesting results, not only for heavy metals, also the contamination with some bacteria, and we published these articles also. So maybe it can be parallel, and it's not only the consumption that you can do the assessment, but also having samples from the food itself. Then you can at least have an idea about this sample of food.
Here, okay, I'm going to have maybe a couple of answers. So this is not the only project, obviously, that we are carrying out. We are also carrying out a project that aims to collect data on occurrence. And like consumption, occurrence has different sources, different surveys being done. In fact, actually, one of the things that we started, I'm going to give you even one of the things that we started. In fact, you can see one of the most recent publications that our group did and made available recently. In fact, I think it was in Food Additives and Contaminants. It's open access. Is essentially an attempt to estimate the amount of lead in honey. So we took one commodity, honey. We took one contaminant, lead. We used that. Why? Because essentially Codex established a maximum level for lead in honey that was adopted last year. So we said, okay, what is the situation in the Arab region? Very difficult to access data from regulators themselves, although we wish we can get that. But you know what we did? We went into a meta-analysis of data that was available in the scientific literature. We developed, in fact, a system to extract the data. Well, first of all, acceptability criteria, I'm going to spare you the methodological aspects. But basically, at the end, we extracted data that we knew was biased because it had different objectives for being represented. And this is after excluding all the data that we consider to be needing to be excluded. But we ended up with thousands of data points on occurrence, I'm talking, on occurrence. On consumption, we use the average consumption that WHO had in its consumption survey for the cluster or the clusters of the Arab region. So we use basically one number for the consumption. But for the rest, we actually did the distribution analysis, etc., and we estimated the exposure. So here again, we are investing also in the occurrence. And you have expressed so many challenges, and I do not want to, diminish any of them. Believe me, even in our countries, the so-called industrialized countries, we will need 300,000 approvals in order to be able to get things. In fact, actually, we have even some limitations. If you do, depending on how you conduct your analysis or you collect your data. So for example, if you partner with the statistics department to do that, because there are, statistics surveys that are conducted in every country, well, you have to realize that by doing that, you will be entering into a field where your data will be governed by another law. That is the law of protecting data collected under the statistics requirements. Which means that even though you contributed even with money on that, you need to ask permission to use the data that you helped generate. Exactly. Because it's subject to that. So all I'm saying here is that absolutely understand the challenges, would not want to minimize them. But as you all know, did these ever stop you in doing something? So I think this is what we need to do, is we are conscious of all the challenges that we will be facing. We are conscious, and frankly, this is why I did not tell you, by tomorrow we will be getting this. No, this is a long-term endeavor, and not only a long-term endeavor. This is something that we would like to build on the long run, because we know that these things will not be done one time. They will have to be updated, maintained, ongoing, and so on, and potentially even modernized for the tools, for the methodologies, and so on. So right now, what we are doing very modestly, as I said, I don't have a bag of money that we are distributing. In fact, actually, for some of you, you might be even better funded than we are, okay? What we want is we want to leverage the collective expertise that is here and chart a path forward where this may be one of the initiatives where you are contributing. It's not actually it's not going to become, I don't have the pretension for asking you that this will become your primary, direction. You are, all of you are well-recognized researchers, experts in your field, and you will be continuing to do the research. I guess what we are trying to do, all of us here, is to say, because you know of this, you might be directing your activities in a particular way that can serve this as well. You see? This and also contribute as to how this, meaning the data useful for regulatory purposes, for risk assessment purposes, becomes generated on a more sustainable fashion. Because right now, I promise you, you say you have this, we don't. We do not. And even if you have and you published, which is essentially what we found out for occurrence, things were published. But things were published with analysis, with so on. I want the raw data. We want the raw data from an exposure. But that's the thing. So when I say the raw data, we want the raw data that is useful to do the exposure assessment. So that's why here, this network is really helping to get this. How do we get even an initial set? Which right now is, I'm at 0. So to be honest, if tomorrow I move from 0 to 100, I will have achieved something. From 100 to 1,000, I'm going to be achieving something, and so on and so forth. While we're developing this. And you're going to tell me if it's FFQ, if it's 24-hour recall, if it's the mix. For 24-hour recall, what is the best way? What are the best ways? And so on. Maha.
Thank you, Samuel.
You wanted to intervene as well, right?
Yeah, I was hoping to reply to Nada. She left.
She's going to come back.
We have option to use telephone instead of visiting people. So this was mentioned in the European studies also. So this to resolve the challenges, to try to resolve the challenge. And also we want to benefit.
Also, it is difficult. It's very difficult.
And nobody will
By
waste time.
email also is available.
It's absolutely amazing, you know, like you cannot stand 3 seconds without discussing methodology.
Yeah.
Also, regarding
This is the main challenge. I know very well how they are thinking, and I know very well what they are feeling. So that's why I'm talking about this. Anyway, I was thinking to have kind of template somewhere to enter the data that was published before concerning the national consumption data that is available already. And maybe we will share with the colleagues to start working on the first objective. And later on, we will be moving to think about the data collection activities, hoping to accomplish the repository objective, right?
Okay, Dr. Maha, once we write the grant, should we submit for you check it?
Yes, we will be drafting together kind of concept note or proposal to submit it for fundraise or for grant or at
And
yeah.
who are the names that will be included on the grant?
We will be dealing with this. I will discuss with Samuel concerning the division of tasks.
University would require an I and the PI on the project.
You will be the PI because you will be collecting data at national level,
And
so it's
only
normal to be there.
one international expert is allowed. Another, if it's allowed, and has have a very good justification why this other person is in. No matter how small or big the grant is.
We will check this maybe later on because it's very small.
It's case by case.
Case by case, because this is not available or it's not common in their yeah, of course.
Yeah, I have a question. In order to facilitate the accessibility to the data and also to do the data collection and to overcome other challenges that we know that there are several challenges. What about if we involve a trusted organization, for example, like WHO, like FAO, like whoever from this organization to be involved? Because, for example, at the UAE, when the WHO involved in any, they facilitate everything. Wherever you go, they facilitate it for you. So, because it is trusted from the Ministry of Health, from the DHA, from everyone, then they can give you access without several questions, yeah, and without any limitations.
They will take the project and kick us out.
Well, if I may answer this point very quickly, and absolutely the answer is yes, and not only that, in fact, we have had a chance to discuss with particularly WHO at various levels, at the headquarter level. So Dr. Moaz Sana, who is the lead of the science advice in the food safety and nutrition group within WHO, who is fully aware of what we are doing, with us. At the same level, at the regional level, we have also discussions with EMRO, so the EMRO region, so the East Mediterranean, where most of the countries are part of. And in fact, actually, we were present at the meeting of the Egypt meeting, where the EMRO representatives of the various countries were there. We presented, in fact, what I just presented to you. There was a commitment to continued collaboration with FAO, WHO. At the FAO level as well, the regional representation in Egypt, I understand also there are new colleagues that are joining the team within the FAO group in Cairo. We happen to have also a base of operation in Cairo, actually, GeForce. So we are very much anchored in the region, in fact. And absolutely, the answer is we would like to collaborate with all the partners. I think we share the same objective here. by the way, in our case, and I know as academics you have issues of ownership, leadership, and so on, and that has to be totally fulfilled and respected. Yes. In our case, we will give you all the credit. We want to have the credit for nothing. Yes. The only thing we want is essentially what you all want, making the data useful and used. Yes. That's essentially what we want. And make it accessible, useful, and used starts with some of these steps. And then after that, we want to build in an incremental way. Again, sustainability will be a big issue. And believe me, we also thinking beyond this. What we are discussing at the level of our region, many other regions of the world are facing, and probably in a more acute way. We do have interest in moving to Africa, even though, again, a number of countries of the region are part of Africa. And there, the challenges are even bigger because the diversity of diets is even more important. So whatever we will learn from our activities in this region will be tremendously important in other parts. And again, I'm going to be giving you also some additional, food for thought here, if I may use that pun, There are some other countries in other parts of the world where you have so small populations that are out there, and again, their ability to have regulatory systems that use data such as this one. And here I'm talking about Caribbean countries, Pacific Island countries, and so on. How do we adapt these systems, these methodologies, in order to collect the data that relate to them? So you see, learning from what we are doing here and developing, really a good level of expertise from this will be useful way beyond. So again, not minimizing the challenges, wanting to go really step by step, and wanting to have something to show for, because as you know, we can only ask for money when we show that we have produced something that is useful, that is used. We will never replace national jurisdictions, we will never replace ministries, authorities, etc. What we want to do, help them. Work with them. At the end of the day, in fact, actually, that's why are we developing this? What we are developing this is that if one day one country wants to do this by themselves with their own money, they will look at this and they will potentially use it as a starting point rather than reinventing the wheel. And rather than actually having so much investment in new experts and new funding, etc., all what has been invested is used and useful.
They do it for the intervention, for future intervention. Yeah, because we need to help them, as he said, because we are not working separately from this organization, and we have to help them in order also to put the policies in the future. And to help that for the country. We are not going also to do the research and then just to publish that and put our names, but it should be also useful for the country. This is my point, that's why we have to involve also these agencies. Yes.
Our colleague from Saudi Arabia and then
okay. Dr. Salima, she wants
to. Go ahead.
We had experience of national survey, and we did the food frequency questionnaire, and we did it household also in 2017. But going, yes, in Oman, but to tell you, it was very difficult. It was very big sample, covering as a national. And one important things right now to also again with what Dr. Halima raised, that we need the organization. It will help us also, because our last national survey was also helped and funded also with the UNICEF in our country, apart from other NGO funding. One important shelling for
what
the
age categories? It was for the children.
it was for less than 5 years of and the mother in reproductive age, and yes, Yes, it was a big, and that's why it was, but it was also involving the blood collection. So yeah, it was, yes, very large, and it was very expensive to tell you. One big challenge for if you are doing also a household interview is the mapping of the houses. I don't know if you have all recent mapping of the houses, because for our, as a national survey to conduct it, we need a very recent mapping of the household, and it is very expensive to do. We can do, but it is really a very expensive. There is error, I think, and there is no actual, and they have to go houses by houses. Still, we are like discussing. In case they will do the stepwise survey and they will do the mapping, it will be okay. We will use their maps, but not yet. They will conduct it. One also. So if there is a way apart from the household, it will be very easy for us.
So,
easier. We did surveys in the health center, and we did it in the household, and we know how difficult if you are conducting it the household.
And in fact, actually, I think that's the type of advice that we're looking for. If you, at the end of the day, advise that it's going to be more accessible, more cost-effective, etc., to do it in another setting, particularly for our countries, well, we will do it in that fashion. But you know right now what I'm tempted to do, because based on what I'm hearing right now, saying that you invested so much. So do I consider that Oman has already food consumption data ready to use?
Yes, food frequency. Yes.
Food frequency.
Yes, but we don't have 24-hour.
Okay, but you have some food consumption data. See, this is for me what I would like practically.
Yes, and it is published also. Published.
If you indulge me this exercise before, if we get this before the end even of this meeting, I would like to use this flip chart and go with every country that is represented in. If I may, sorry, Dr. Salima, because my colleague there is not happy with me because I'm not using the microphone. So we could go country by country that is represented around the table. And we identify what is out there and what are the limitations about it and how accessible it would be if we want to put it in a repository of data. For me, that would have achieved a big objective of this meeting. Because I'm going to tell you, Dr. Salima, we have the privilege to work with colleagues from the Food Safety Center, Food Safety and Quality Center, with Dr. Hussein and colleagues, and with Dr. Intisar, etc., who are setting a risk assessment group. These colleagues will not be able to work unless they have access to the data that you have. And essentially, if we work together, and perhaps again, and I'm thinking this, I don't know, you have data for Oman, but one could argue that potentially some regions of Oman may have similar consumption patterns as Yemen. I don't know, I'm making that assumption simply for geographic reasons, okay? I might be completely wrong, and please don't use this as a real example, but just to make the element. So if I do not have data for Yemen at all, can I use some data that might be available from Oman? Well, you say no, but you know what, Dr. Dara, I'm going to tell you this. I'm going to tell you, no, but you tell me this. I'm going to tell you as my reality as a risk assessor or as a risk analyst. In Canada, when I did not have data from Canada, I used data from the United States. But I know that lots of people in Canada consume different ways. And again, the diversity of the consumption in Canada is so big. But you know what? Beggars cannot be choosers, if I may say this. So at the end of the day...
But there is a rationale. Why would you use the US data for Canada?
Absolutely.
Possible food import.
Absolutely. So that's why. I'm using this for the same rationale. No. Okay, so please forget my example. Country X and country Y. So let's say country X has data, and country Y has some similarities with country X. Similarities being in the food supply, similarity being in the imports, in the economic, situation, etc. So the rationale can be made to use data from country X for country Y evaluation with caveats associated with that. Not at all in GCC countries. So essentially, people in Bahrain consume completely different things than people in Qatar.
Kuwait, for example, in Qatar, similar.
Okay, so so thank you for correcting me. So there are some possibilities.
Yeah.
Yes, we say no, so it's gonna be no.
Can I jump and just
Well-
change the topic a little bit, if you allow me? So, just to sum up, because we are talking to different, sometimes we're moving about existing data,
Yeah.
then the other way, we just jump to future data.
Yes.
So let's talk about existing data. My question is that, so you want the raw data, but in terms about the agreement about the availability of the data, the copyright of the data, how gonna be work, like how it works? Is there any agreement? I think that's very important information. I need to I need an answer in order to go forward of any future studies.
I think that's a very, very important point. I guess we will go with the limitations that is associated with your data. So what we said is we have an objective ourselves. The data is to be made available, accessible in the public domain. That's what we would like.
But the copyright of the data would be to...
It will be, right now, it's in the public domain. So it's essentially, it's just like an open access paper, right? An open access paper belongs to the people who wrote it. So that's what it is, right? An open access paper. There is no PI.
Yeah, I know.
PI is it's in French, so IP. There's no IP. So there is no IP in the sense that, and that's, again, which means that any data that has been generated with an IP that is not shareable will be excluded from that list. If we cannot, unless an agreement can be struck and the recognition will be made. But that agreement cannot involve money because we want to have data. Absolutely.
I'm not talking about money right now.
Yeah, no,
I
but
know
what
they
we're
go
saying,
far away about funding. I'm
absolutely.
talking about the agreements
Absolutely.
and the copyrights.
Absolutely.
And how the data will be stored.
So, and
How to be
that's
stored,
these
like,
are things that we will discuss. We would like to. That's one of the question points. How, where, who? Okay, we are not necessarily saying it's us, but it could be us, in the sense that that will involve money because that will involve investments, servers, protection of the information, and so on and so forth, right? Yes, and what we would like again is we are not necessarily interested in the data as you collected it. We are interested in the data extracted such that it is usable for exposure assessment purposes. So all the protection of privacy, of all the things that you went through in order to get the data, that's yours. So you see, I go back to the same objective.
Because if we have an existing data, we already got IRB for an existing data. So the question would be, from ethical perspective, the data should not be used to another. We need another IRB for an existing data, right? I don't know about it from ethical perspective.
And I guess for that purpose, you will need to go through.
The IRB will be different because when we created the IRB for using this data for these purposes,
Isn't a secondary data considered now if it is available or published or I don't know.
I think that's different from
secondary
one
data.
country.
It's not anymore primary data, so it doesn't need any more IRB. Even if it is secondary data, we don't have this in Lebanon.
So
it's okay. So
okay, we'll go that.
I want to ask about
Yeah.
the data.
Okay.
From 6 to 12 years old.
Yeah.
This is my PhD data.
Yeah.
Around 600 samples from Iraq, 24 hours. It is available.
I can tell you something. Yeah, but you know what? I'm going to tell you something. And here it's not something that I'm proud of, but I'm sharing with you the reality. For so long in Canada, when we needed to do risk assessments and exposure assessments in the 2000s, the only access that I had was a 1996 data. And that's the only thing I got. And I used that. So essentially, as long as, you see, as risk assessors or risk analysts, we use what is available and we qualify what we use. So at the end of the day, if I have an answer, I'm going to say, this was developed with the conditions of this. So essentially, if consumption patterns have evolved in going up or going down, but you see, we qualify that information. So what we need is we need to have a characterization of the risk, and then after that, I qualify that characterization. You know, and I say, like, for example, if you read the article that we did on lead in honey, what we found was the following. We had two things. We extracted the occurrence data from published information, which meant what? It meant that the data was biased, entirely biased to what was published, okay? And in some situations, what was published was biased towards more occurrences, or what was published was biased towards things that were not reported.
But how is that good for policymaking?
How good is it to have nothing? This is the answer. Right now, what I got out of that paper was questions as to where I can direct my investments. But I started with something. We identified some countries right now where the margin of exposure is too low. So which actually gives us an idea. And even though we said the margin of exposure is too low, we're qualifying that. We're saying, you know what, it's too low because I may have biases, but I also identified something else. The amount of honey that we used for consumption was, I believe it was 0.08 grams. 8 milligrams, basically. 8 milligrams, if I recall correctly. I'm speaking out of memory. But all I recall was, it was, for me, too low for some high consumers in the Arab region. We know that honey is mentioned in the Quran. It's also known for its nutrition benefits, etc. Some households or some people who are on the high consumer side, I mean, you can find people who never consume honey because they have a problem with honey or taste or whatever. But you have also people who would consume a lot of honey. So by using the number that I used, I may have completely underestimated the amount of exposure that I have, particularly for the high consumers. So you see, at the end of the day, what I had out of that paper, what we had out of that risk assessment is a number of questions that we want to address, amongst which through this. So essentially, to be honest with you, if I have the data of our colleague from Iraq, because Iraq was one of the countries where identified. No, but to tell you, like on that basis, we identified, in fact, some issues of high level of exposure to lead in Iraq, and we attributed that to, of course, the war situation, etc., the pollution in the environment, therefore contaminating flowers, therefore contaminating where the bees feed.
And then you can compare between the 14
Exactly. So that's also, you see, so these are the type of things that we want to have. As I tell you, I'm going to even tell you worse. We did assessments in the 1990s and in the 2000s, and the only data I had was 1972. 1972. When you need to do an exposure assessment, you will have to use the data that is available to you. So right now, this is why I'm telling you, you are sitting probably on, for me, gold mines that I'm only seeing from afar. So even though you are probably, criticizing the data and you're saying, so limited, etc., myself right now, I'm like, I have nothing. Okay? So essentially, to go back, we need to solve or to address IP issues. We need to look at all the ethics requirements. If we need to reapply, we will reapply, or we will work with you to reapply. If we know that it is exempt because it's reuse or it's in the public domain, etc., we will do that. If we need an agreement for the IP, we are happy to work towards these agreements. As long as you know what is the finality. Our finality is a public good used by regulators, used by the international community, so working with FAO, WHO, because potentially this data could be also input into international databases, like the GIFT database or other databases that are out there, so that when JECFA does its analysis, it uses data representative from the region. So that's what also we would like to do, is to maximize our input in international processes. And then the time, Right now, I have nothing, so I'm not going to exclude anything.
Okay.
So you see, and then after that, when I have it, we can look at it with a critical eye. We say, for this assessment, of course, if I have 1990 data and I have 2015 data, I'm going to privilege the 2015 data. But if I have nothing, I'm going to use the 1990 data. So, I don't know, sorry, Dayal?
Yeah, just to move forward and to make the discussion easier, let's define exactly what are the raw data that we need and we are looking for to see if we have any challenges that we might face it. Because to my understanding, if like I need like a gram per day of specific type of food, I might find it in some papers, whether open access or not, and I might be able to use it just by putting the reference. So what are the details and raw data that we exactly need so that we decide accordingly what are the challenges that we have case by case, right?
The best data, I'm going to tell you, I mean, here I would probably ask even some other experts than myself to tell you, but I'm going to share with you just my limited experience with this. What I need is for commodity X, like for example, it can be milk, it can be like, liquid milk, as an example, if I take that, okay? What I need is the person, the characterization of the person, so that individual, if I can have the age of that person, the gender of that person. If I do not have the weight, I can actually live without. But if I can have the weight, that can help as well. So yes, that's essentially what I would, and then the amount that was consumed. Knowing that from there, I will be extracting, because as you know, the data is manipulated in several ways. Like, for example, when I'm going to give you an example now. I'm going to be doing a risk assessment for melamine from dairy-based foods. I'm going to be going through all my food composition, my food classification system. By the way, that's another challenge. Because if we want to create databases useful for risk assessors, I need food classification systems that are also harmonized. Right now, as you know, the system that is most harmonized is the Food X2 system from the European Union, from EFSA, okay? So I need to go through that classification. I need to extract the food where dairy is there, and then I'm going to take all the different amounts that are consumed from there, and I'm going to get a number from there. But I'm going to get a number for the different ages and the different groups and so on and so forth. And that's how I'm going to be using that in order to do my exposure assessment. So it depends. The data can be used on the basis of an ingredient. The data can be used on the basis of a commodity. The data can be used on the basis of the exposure assessment targeting a chemical in different foods. So I'm going to be looking at all the different ingredients where that contaminant occurs on the basis of where I generated the data through my occurrence database. So you see?
Yeah, the optimization.
Doctor, very interesting, all of this information to digest. I want to validate something. When I said that probably Oman is different from Bahrain, from different Kuwait, from Qatar, even though we are all Gulf countries, because in my experience, when I do the Kuwait national representative data, and I even compare the regional, south of Kuwait compared to the middle of the Kuwait, the areas near the sea compared to the one furthest, and even though we are modern internet, all of us ordered from talabat.com. There is huge difference between those areas, and I see it. And also, after generating this data, it would be interesting to see. Of course, we have some dishes that we all eat, like rice and meat, fish and meat, and or rice and like that, rice-based dishes. We all eat, or curries, we all eat. But even the consumption of these is different from a household to a household, from a region to a region. And maybe after this study, it would, for us dietitians and nutritionists, we can have more reflection on that. So this is what I want to qualify.
Can I react to that?
Sure.
So in fact, what you're saying is extremely important, because that's also what we want to qualify when we do probabilistic assessments. So that's why we want to have individual data points with the diversity such that I can have extreme scenarios. Basically, again, as I tell you, we use the data because we have no choice but to use the data, but we use the data with a critical eye. If we have generated the data in a manner where the population that I have is so homogeneous, okay, I will use that with that eye. If we know that in the data that I generated, we probably excluded a huge chunk that probably might be high consumers or low consumers, we will also try to address that. And in fact, sometimes I might have a complete assessment and then I'm going to say, but for this subset that I seem to have ignored on the basis of limited data that is telling me that they may have high consumers, I'm going to do another exposure assessment and I'm going to say for these guys, it's going to be this. So as much as you can capture this diversity, we want it.
And also one thing is about the expat.
Absolutely. And the locals. And the local.
This is something in the Gulf is a major thing because expats are more than the locals.
Absolutely.
So we have to be representative of the expats too.
Absolutely.
To assess any
Absolutely.
exposures,
Absolutely. So in fact, actually, all what I'm saying is that the challenges that you face are actually challenges that are faced by everybody. Like in Canada, for example, I can tell you, our Inuit population, our First Nations, do not have the same consumption patterns as some people living in the basically 200 kilometers north of the border with the United States. I'm going to even tell you something. People in Nova Scotia have different consumption patterns as people from Alberta.
I did the study on the Inuit and the groups are different.
Absolutely, exactly. And even in Inuit population, you have differences. So I guess actually we're all agreeing on that, but that's what we want to capture.
I just don't want anybody to get sensitive about what
No. Look,
there's
no sensitivity. There's absolutely no sensitivity.
I'm not trying to say
No.
we're different.
No.
We're the Gulf, we're the same, but diversity exists.
And we want to capture that diversity. In fact, right now, our problem is that we do not have that diversity anywhere. I have averages. The only thing I have is 0.8 milligrams.
And I think as a scientist, I get excited about the differences and identifying the differences more than if I say everybody is homogeneous. I think that is part of studying dietary patterns, you know?
Yeah, hence the probabilistic
exposure.
We want to have the distribution with the probabilistic.
Yes.
Yeah.
So,
Okay. Very exciting discussion. But while you are discussing, I'm connecting with my colleagues in Morocco because I cannot just pronounce
it. With ONSA colleagues? Or
no, my friends.
No,
not ONSA.
To deal with regulators.
No, not ONSA. This is the how is it in French? No. This is my colleagues in the Centre de Recherche. Yeah, this is a regional designated center. So I'm an associate researcher there. But I don't have all the information because I was living abroad anyway. Now, I think that we are all having the understanding what we are supposed to provide or to obtain. I'm someone very pragmatic. So first step is to go through this mapping, okay? And then we try to get this food consumption data. But I think, and from my understanding so far is, the approach that is going to be undertaken, it may be different depending on different country, okay? So I'm having some good news, but I'm not sure whether it is that very good. We already have a national study, and they have done the food consumption, the food frequency questionnaire, and it was run in 2019. So we have some data. Again, I agree with Dr. Abi when she talks about the ethics and the IP and everything, but I think this is like technicality that we can discuss. So, my question now, can we just consider it in a reverse way? Instead of saying, this is what we need, better to say, what do you have? And how we can just complete it.
This is exactly what we want.
Yeah.
We want to start with what we have.
Yeah.
And qualifying also what we
Yeah.
have. So essentially, if what we have has limitations, like for example, if the data from Iraq, the only thing that I can access is the data that was generated through the PhD of our colleague,
Yeah.
I'll get that and say, this is what I have.
Okay.
Okay? But I'm starting with something. And again, really what we would like is to generate this database for your colleagues' risk assessors. And as I mentioned, our objective is to make something available in the public domain extract it in the manner that a risk assessor would use, that an exposure assessor would use. So essentially here, we would supplement this group. This group will be supplemented by data users. Because if we don't breed them, then we'll be asking the question again and again. So we will supplement this group with a couple of exposure assessors who have done so many of these, and will tell us, what I would like is potentially a template that contains this in this fashion, and potentially another template that contains this and this. But they would not be able to tell you that unless they know what you have. So we start, if we can, country by country.
Yeah.
What do we have? How was it generated? Household, individual, etc. Was it generated 24-hour recall, food frequency questionnaire, etc. Age, time, how long ago it was done, etc. Then, what are the limitations for the data? Accessible, IP, agreements, you name it. And then we identify all that, and in fact from there we can even prioritize how that extraction will be done. We will then work on the development of a template or templates. I don't know if that's going to be one, maybe templates. And with the limitations that you may have, we start having a process to extract the data and start populating this repository. Start. And when we have something, I told you about occurrence data. This is how we started. And I'm sharing this experience with you, so I'm just going to use this just so that Elie is not here, but I know that, you're listening. Okay, I guess I'm loud enough. I don't need a microphone, eh? So I'm gonna leave this. How about that? No, I can use it? Okay, no, it's okay. No, I'm just saying, I'm loud enough. That's also that's the common joke out there. So, but for occurrence, just to tell you, because again, I'm a chemist by training, so that's kind of my little world, We knew that if I started by saying, okay, my objective is I'm going to be knocking on every regulator that has a laboratory and I'm going to ask them to give me the data, you know where I would be? I would have gone nothing. Nothing. Okay? So we said, we're going to do it stage by stage. Stage 1, publish data. So much of it. And again, so much of it may be good, usable, so much of it may need to be excluded. So we essentially developed an approach for the extraction of the data and the qualification of the data. We actually created a database that was in fact supported, and that's why, talking about working with WHO and FAO, in fact, WHO accompanied us in this process, and we worked on the creation of a database that mimics the GEMS food, that is inspired from the GEMS food database. Why? Because we wanted the data then to be useful to be uploaded to GEMS food. We used the classification, the food classification and categorization system that WHO used. Because again, why recreate the things? And then, believe me, again, I think Layal with some of your, here again, it was with academic colleagues. We worked on very meticulous process of reviewing publications, in fact, if you read our paper, the lead paper that I mentioned, I can give you the reference, applied that for lead. But we did it for pesticide residues, we did it for mycotoxins right now, we are conducting that for mycotoxins, and heavy metals. And essentially what we said is that when we start with that, we will have a database. When I have data, I feel more comfortable knocking on the door and saying, you know what, regulator X, can you please volunteer? You're doing so many data points, you're generating so much stuff. And again, our interest is not to get the data that gives me yogurt trademark X contains W. No, what I'm interested is yogurt contains X amount of whatever contaminant. And it's the commodity yogurt. And what I'm interested is that yogurt is sold in Qatar, or even if it's imported from Turkey, from Canada, from wherever it might be, it's sold in that country. So if it's sold in that country, it's consumed in that country. So that's essentially what we wanted to do. We started that, and then I'm knocking now. Now, in fact, I am at the stage where we can knock on the doors of several regulators and saying, look, we have two things for you. we can supply you with the same database that we have generated. Would you mind extracting the data and putting it there? You know, anonymize it. I don't need to know the trademarks. I anonymize everything that you want. But my 2,000 data points could potentially become 10,000, 100,000 data points for that particular commodity, for that particular contaminant. And we build on that on an incremental basis. And of course, we have the information by dates, etc. So if one day I want to use an exposure assessment that takes me back to the 1990s, I can do that. If I want to stop at 2020, I will stop at the samples at 2020. But the power of data is that when you have it, you can ask for more, if people are willing to collaborate with you. And what we want is basically to equip risk assessment agencies in the region with the tools that they need so that they collect this data in a continued basis. We want to sustain this. We do not want to have one-offs. And I know you are academics and, you know, like project-oriented, but I'm sure that you agree with me about the sustainability of the endeavors, okay? And ultimately, if I give you my dream is basically that we have the EFSA of the Arab world. That we have basically the institute, the center, that has all the access with the academic community that is so well connected where we can actually get that information. Again, I'm a food regulatory scientist, remember? So that I can use it for making assessments to support decisions. So again, I'm sorry, like I'm repeating myself a little bit, but I'm really reiterating really the direction that we're having, and again trying to also share with you the fact that anything that you are willing to give us will be definitely a plus from where we are right now.
Yeah, I can support you in this, and I share the positive experience we had while doing the data collection about occurrence. Amazing Excel database data sheet, a lot of information pooled in one place, and you look at the data in million different ways. Now we wrote a first paper, we are preparing and planning for another one, and we can use this data for different data analysis, look at it really from different perspectives to inform policy and regulation. So really this is a goldmine tool that a first initiative we worked with Dr. Samuel on pesticide residues.
I fully support this because we also worked on the heavy metal and we had a broad data and excellent data that show in the region, the whole region, how much the kind of exposure or the occurrence data, it's kind of data mining. So I fully support it.
And at the end of the day, so also going back maybe to the IP also to further say, at the end again, what we want is that if people want to use the data in any way they wish to make their own analysis, to extract whatever conclusions they want to have with their own methodologies, that's what we want. We want to stimulate scientific activities in the region, and basically we are claiming no ownership. So this is, I'm repeating this. We have and we would have no ownership. The ownership is the public good. So anybody can use this. Of course, what we want though, and this is what we will work with your advice, we want to protect the integrity of the data. We want to make sure that nobody can manipulate the data, or so like the access will be controlled in that fashion. We will be making sure that, you know, the security and the integrity of the data such that it can be used for scientific purposes is well guarded. And again, we will do that also with your advice, because you know what may happen more than we do, in fact, for that matter.
I have a question. Back to Dr. Halima. Where is Dr. Halima? She's gone. She said that about the FAO and WHO collaboration. Mm-hmm. What benefit is working with WHO? Yani, what kind of support or yani, benefit for us on this project? This kind of collaboration?
Many benefits, I can see. Many benefits. Well, first of all, FAO and WHO are, of course, representing the public good in the sense that they are UN bodies, representing really the general direction that as a community, you know, this type of data will be used. They are the custodians, first of all, of the Codex Alimentarius Commission. they are also the responsible for so many capacity building programs in the region. They are also the responsible for the scientific advice that we rely upon as a collective, as a community. They are in fact the custodians of JECFA, GEMRA, JMPR, GEMNU, etc. Yeah.
But I mean, for our immediate collaboration, like for me.
Okay. The other option is they might have funding that we don't have. So you see, they can also contribute with funding sources as well. So we could leverage some funding that they might have. They might actually support us with dissemination opportunities as well. So all I'm saying is, I'm not, I don't want to either maximize or minimize the role, but all I'm saying is that this is almost a natural collaboration. Now, at the end of the day, though, we're not waiting for, we are a community here of scientists. We want to work ardently with our international organizations, but we also, you are masters of your own fields, and we know also through our involvement with various regulators the amount of needs. So we are willing to, progress in conjunction with our collaboration with FAO WHO. In other words, I'm not waiting for funding from FAO WHO to start. That's what I guess what I'm saying. But we benefited from funding from WHO, and we were so happy to receive that. Again, it was modest funding, but anything helps. So that's also the thing is, we are working, I guess what we're trying to do is we are building a community. We are building a community of expertise. And right now, I know that you have these pediatric conferences or nutrition conferences that gather you. What we would like to do right now is we want to have these regulatory forums that gather you. Because at the end, the regulators are thirsty for the data that you generate and for the data that you are potentially generating in the future.
I just have one comment regarding the WHO. They can fund some projects, some small projects, and even the pediatrics. I mentioned in the conference they support the five speakers, fully support for accommodation and tickets, so that they can help. Especially, for example, in Jordan, I know they supported many projects regarding food insecurity, regarding even consumption survey, but a simple one. So they have a good role in supporting or funding small projects.
Yeah, and for our last project, UNICEF funded in a huge amount, actually. It was, yes. But the way in our country that the project between the WHO and UNICEF, they usually, this project can be handled by UNICEF and this project can be handled by WHO. Like stepwise survey, it is usually with WHO, but the nutrition survey is usually with the UNICEF in our country.
So how's the mechanism? You would apply the grant in your university and then at the same time you apply it for the UNICEF. How do you do it?
We don't apply it in the university. We have the Ministry of Health. So we will take the ethical approval from, we don't apply for the grant. There is the country, yes, for the grants. We have country office.
So you submit your grant?
No, it is usually...
No, it depends on the availability of grants in the country office. For example, in the country office in Lebanon, they supported the food composition table that we did, okay? And from the AMRO, we published around 28 published data. They supported partially the food consumption survey in Lebanon also. So in this way, if you are thinking to apply for something.
Can I start with Dr. Ayub? Because Dr. Ayub, maybe it would make it easier for you. What person you should reach?
We have a problem that for the ethical approval to be given, we have to assure that the data will be dealt in the country. So all the analysis should be done in the country. So we have to write it that it is not allowing to do all the analysis outside the country.
Yeah, even Kuwait University.
So the data cannot be publicly
No, it is the raw data. I mean, the analysis that it should be. But the result, yes, result we will publish, of course. But the raw data, you want. Huh?
No, but actually, see, maybe I misspoke about what I mean by raw data.
Yeah.
See, we don't need the raw data as you generated it. We need the data treated somehow to be able to use it for the purposes of risk assessment. So we do not need Excel sheet. That's fine. We need to have a template.
Maybe Samuel, we should agree.
No, we should not do a template. That's the thing. I think one of the things is we need to generate this template. We need to
exactly.
develop this template.
And also to deal which source we should use concerning the classification of food groups. Are we going to use the JAMS?
Yes.
So which one?
That's the thing, and I think we have to have an agreement on that. Honestly, I do not have.
Or simply the USDA, because almost all of us are nutritionists or in the food science field. So the USDA also, they have the classification, but I don't know if this will serve the regulators.
No, again, the USDA classification for the most part serves regulator purposes because the Canadian system is based on that. So I think what we need to do is we need to create an Arab classification database, like an Arab classification system. And it is. It is one of the standardization aspects. In fact, it is one of the key. For my little experience in working with colleagues in China, they had to go through the same thing. Of course, they didn't start from zero. They mapped all the different food categorization or food classification systems used for exposure assessment. So they looked at all the different sources, FoodX2, US, Canada, etc., etc. And they developed their own Chinese food classification system, which actually, when you look at it, it's very close to FoodX2. I mean, a lot of even FoodX2 and the USDA, you will find lots of similarities. I mean, you have a major group and then subgroups, and it's really how you define the subgroups when you go down, really, into the subcategories where you find the differences, okay? And for them, they had to accommodate some foods that did not exist in the European system, right? Because they have different foods. Although now I have to admit, with the globalization of our diets, I mean,
we should go back to the traditional dishes also to include this.
Right now, it's easier because, frankly, our chicken biryani right now is, I don't know, you can find it everywhere in the world, right? Of course, after that, absolutely. To have your own little system, that's why you need to have your composition tables in order to know the recipe may be different from the other ones.
One thing also, the food frequency which we conducted is not having the exact amount. So it is only the food group and the frequency. So it is not having the amount. So we need to do the 24-hour.
My colleague doesn't have public data because of the issue she raises that they feel ownership of it and they don't want anybody to publish a paper and put their name or not put their name or all of these issues.
I was talking to somebody in the conference. The Amouage in Iraq, they have millions of data. Many times we write to them to get the data to publish, then they refuse. They didn't give us the approval to get the data, even to publish a paper. The Amouage, they said, this is a secret, this is our goal, you cannot share with you, and we cannot give you the data. This is a problem.
I think it's more sensitive for occurrence data, but for consumption data, it should be easy. How much people consume, individual age, there is no sensitive information in it.
Technically it shouldn't be, but again, I told you.
Data about NCD. You can imagine about NCD, they refuse to give us the data.
I think it's different from a question. When we conducted the survey, two of the students in the university, they asked us for the certain data, so we provided with the data for specific studies.
Yeah, but they were Omani researcher, right?
Yes.
Yeah. So in Kuwait they have this. If you are a Kuwaiti researcher, but you have to be also there is some kind of requirement. Yeah, not any Kuwaiti researcher they will give it to. بعدين مثلا if they give it to me, I can't give it to him because he is he's gonna publish with Laval, for example. So they have an issue. Why is Laval there? They will make an issue by it.
Yes, dealing
Yeah.
with the to be in the
country and not other affiliation. Yeah.
And this, it's like there is another request using after you finish the survey.
Yeah.
There is another request to use explaining this. So yes, maybe through the minister
And I think actually at this point, I'm going to tell you, for example, if I take the example of Oman, let's take the example of Oman, because that's very, concrete example. Why do we need the data from Oman? For the most part, for the Omani risk assessor to conduct their job. So essentially what we want is that the Omani risk assessor, in the form of the Food Safety and Quality Center, be able to enter into a discussion with you, supported, maybe facilitated with our collaboration, such that accessibility of data be made so that when we do exposure assessments in Oman, they are based on the data that you generated.
Yeah, but you will have the volume there. You will
No,
have someone
we absolutely do not need to have any of our names there. We are not doing this to have names. We are absolutely...
Because the data will be publicly, so someone will get the data,
Okay.
reanalyze,
So,
publish a paper.
no, that's the thing. So let's take the example of Oman once again, okay? Because again, we're going back to the objective here. Our objective is not for Laval to have the data or for G-Force to have the data or anything. Our objective is for regulators to be able to make the assessment according to data that represent their jurisdictions. So for us, the win, if I take Oman case, the win is that the Food Safety and Quality Center of Oman is collaborating with Dr. Salima and getting the access to the data in such a way with the analysis, so essentially leaving the raw data aside, with the analysis that is needed, such that that data becomes really the standard use for exposure assessment. The Food Safety and Quality Center then, as the custodian for risk assessment for the country and responsible for a number of decisions, regulatory decisions, will probably, and I'm making here an assumption, will probably make available that data for potentially stakeholders when they make submissions, etc., will be able to use it. Because what good is the data if it's only kept secret within the group themselves? So essentially after that, it's their decision. It's the decision of the country to make that available. If they want to contribute that to our database, they would. But as long as it is accessible somehow through Omani sources, for us, that's objective accomplished. You see, it's accessible through Omani sources.
I think that's how it should be.
I think, it should be the data in the repository should be individual researcher data and not unofficial data from OH. This is my point of view. Because if you want to get OH data, it will be impossible to be publicly available in your domain. So the best is to go to the researcher. We ask for their data if they want to share it publicly and make it available. But of course, the researcher, if they want their data to be publicly available, they will ask us what benefit me. In the future research, my name will be there or no. They will ask many questions. I don't know about money. Even some researcher, if they spend money to collect the data, they will ask for money to make the data publicly available. Just to be honest with you, some researcher, they are money-minded. So they will ask, what benefit me for my data to be publicly available in a domain? Research benefit or money benefit or something else, I don't know.
And I can tell you there, actually, because we will be developing eligibility criteria, that data will become ineligible. It's as simple as that. Because yes, we are desperate, but not that desperate. So that's why. So in fact, I think we go back, I think you have a lot of questions, and I think we will all have many more questions. But as long as we we have a general direction, and we have also some values that are guiding what we're trying to do. I think the objective, again, reiterating it, is for regulatory processes, use risk assessments, relying on accessible consumption data. that will allow for the risk assessments to be representative. That's what we want.
Exactly, and this is not a simple project that it will be based only on academia and publishing papers. It will be a kind of big initiative to help food regulators and later on to include the Arab region in the worldwide food policies and etc. So sometimes we work without funds. Sometimes we pay from our pocket money, and sometimes our research assistant helped us for nothing, and sometimes their names are not mentioned in the papers or in the project, but we are sure that we want from you and from your networks to help or to be able to achieve the objective listed in the presentation. I would like to thank you all for this fruitful meeting. And
Maha, can I don't want to conclude if people are still with us because lunch is not ready yet. So is it,
of course,
is it possible to indulge a little bit more? I'm sorry, you know what? I tend to be maybe opportunistic. You are here, you are with us. I don't know when will be the next time I'm going to have you. So I would like to go, if you don't mind, to go through the list of countries that we have identified.
Okay.
And I would like to start documenting the mapping. Just even if we don't have the references, etc., just to know, based on your knowledge, what is out there? Like if you tell me, you know what, there is food frequency questionnaire that was done in that particular date, etc., etc. You know, like if I'm going to give you an example, and you tell me maybe I'm doing this too quickly, but given that you are here, I would like to have this documented rather than sending you another email and expecting an answer from you, giving you, you know, like another email to answer. So for example, if I take here Saudi Arabia, if I take this as an example, I'm going to say, okay, Saudi Arabia, what type of consumption studies that are available? How long will there be? Have they been made that you know of? How accessible do you think it would be? You know, like this is the type. So if I could get that information,
I can reply to this.
All of them.
Yeah.
Okay. Well, how about
Per
that?
country.
Yeah.
I have the Saudi Health Interview Survey.
Okay. Can I wait? Can I actually? Can we type it here or?
Yeah, of course. If you want to.
That's what I would
access
like.
your
I would like
email,
basically.
It's available.
Yeah.
I have this question. You said you sent a report. Did you make the slides and you sent your map?
It's Excel sheet that show the mapping of per country of the national consumption. It's 6 documents.
And shall I have it?
No, this is on WhatsApp.
And I should send it email?
We send it by email. Yeah.
About WhatsApp and I
No, this is summary, kind of summary for the job that we did. Yeah.
So if we do, you know, an initial, if I call this initial mapping, right? And sorry. And if we start, basically, I mean, I'm using the countries as listed here. So we said Saudi Arabia.
Yeah. Can you please check the junk?
So what do we have?
We have the National Multi-Stage Survey. It's called Saudi
National
Health
Multi-Stage Survey.
Yeah. It's SHIS, Saudi Health Interview Survey, multi-stage. 10,735 person.
10,000
Yeah.
plus, I'm going to put 10,000 plus basically data points. Is that what we're saying? Data points?
Participants.
Ah,
yeah.
participants, yes. Wow, it's amazing, yeah.
Individual age 15 years and more.
Age 15 higher. Okay.
And the response rate was high, 89%.
89%.
Always Saudi Arabia response rate is high. It's yeah, I'm checking.
And the year, yeah. And I don't know, our colleagues from Saudi Arabia, are you aware of other things that, you know, is underway or something beyond what is? No. Okay. Yeah.
2017. It's published 2007. I'm checking.
So
2013.
Summer 2013.
Yeah, 2013.
2013. Okay. So our colleague from Saudi Arabia is saying that you have several FFQs potentially.
No, I mean, generally, not for me.
Yeah.
Okay, but they use FFQ or 24-hour food recalls.
And
we do have some scattered, some papers where they analyze some local or tradition data.
They use diet history measurements. Yeah, well, I will send it back.
Okay.
Um,
Okay.
I checked. I sent.
That's for Saudi Arabia. If we want to move to
diet history.
no, for the first one. No, but I put other sources here for the other source. So here it's diet history, right?
Yeah.
Okay. Now if I go to another country, let's say Bahrain.
Yeah, we have Bahrain.
So what do we have?
Yeah, give me this 1 minute.
And we have a colleague from Bahrain, or yes, and
We have that already. They have done or did it in 2002.
but that's okay. That's okay. So I mean, you see, as I told you.
National Nutrition Survey.
Yeah.
For adults.
So what is it then?
National Nutrition Survey.
It's a national nutrition survey.
2,301 individuals.
2,300 plus, okay.
Yeah.
Individuals.
19 years and over.
19 years and over.
Representative survey.
Okay.
24-hour recall FFQ.
So 24-hour recall plus FFQ, both.
Yeah.
Okay. That's interesting. Okay. Moving on to Oman. Dr. Sanima.
I don't have Oman.
But Dr. Sanima does. Yes. No, roughly, in general, an idea.
It would not give the quantity, but just shows how
Okay, so there is no quantitative.
It's only about frequency? Yes. This doesn't show the gram per day. So.
Okay.
Oh.
So this would be limited, yeah. So survey
That's why we
on
didn't find anything.
frequency of consumption. So it is qualitative study.
Yes.
Okay. You rose my hope up so much.
Yeah.
I thought Oman was solved, you know,
Yeah,
like
we saw
I put a check mark. It's okay, it's okay. You know what? That's okay. That's okay. We're on our way. I mean, this is the starting point already. Looking at the glass half full. So, okay, that's Oman, and then we're gonna move to Morocco.
Morocco.
Nothing.
Well, we have national studies. I'm having the report right now.
Okay.
But I'm not sure about there is a frequency of consumption, but again, same thing happens like in Oman. I'm not sure whether they have it's only qualitative or only or it includes also quantities. I'm not sure about this, but it is qualitative.
Okay.
I'm not sure about whether they also have the amount.
Okay, so qualitative studies, okay. But I have heard, and maybe this is to be confirmed, because we do have some colleagues with ONSA, that essentially ONSA is embarking on a study right now, or at least some kind of a design related to food consumption data collection, being the regulator. So I don't know if that collaboration is taking place or if they are doing it individually, but this is,
Maybe I'm not aware of it.
Okay. Okay, perfect. Thank you. If we move to the list, Iraq. I'm just following the list that I have here. So no particular order, Iraq.
I have my data in 2011.
Okay, so 2011 data.
Primary school children 6 to 12.
So it's 6 to 12-year-old.
Yes. 24-hour recall and FFQ.
Okay, year old. So we have 24-hour recall and FFQ. Okay.
Around 570.
570 subjects.
There is a study in Iraq called STEPS. It is conducted by
NCDs.
Yes, NCD.
WHO.
Yeah, WHO did. 2015.
Okay.
I think they got FFQ. But
Okay.
I'm not sure.
So
I
it's
think my friend who wrote the report.
NCD study conducted by WHO, and we said 2015.
I will check if they
Okay.
have FFQ.
Okay.
There is some FFQ.
There is only
7
a
question.
portion for fruit and vegetables.
Yes.
Oh, only this.
This is what I know.
Yeah.
Otherwise,
So it is not in details.
It's not okay. So not details. Okay.
So
So
only this one.
so then I will take it out. This. Okay. So I'll stop here.
Yeah, just this one. which is-
Okay. That's it. Okay. So
Now for Qatar, we
Qatar.
don't have national survey, but
Okay.
we have Qatar Bioban. And Qatar Bioban, we can extract qualitative, not quantitative intake.
So qualitative intake.
Yes. For specific food items like fast food, rice,
Specific food items. Okay. No. Of course.
hot drinks.
Okay.
But not quantitative.
Okay. Not
But,
quantitative.
and I heard it from one of the Ministry of Health. They are now working on a national survey.
Okay. But who in the Ministry of Health? The nutrition
Hind.
group?
Yes, nutrition group. Hind and Dr. Saleh
Okay.
or Salah Yafi'i.
Okay, so nutrition group
Yes,
in MOPH.
Communicate with them.
Okay, well, I guess that's actually definitely an element to
We are doing now FFQ, but I think national survey needs more 24-hour video, or both of them, yeah, offline, quantitative and
Yeah.
qualitative. We are now working on FFQ. Like,
Okay.
we have already one FFQ published, one for scientific research, but they want like for the some food items added, typical traditional Qatari food items.
Okay.
So we are now developing a new one.
So a new FFQ. Okay, so I'm gonna put actually kind of another like point here. New FFQ under design, targeting Qatari traditional foods.
Qatari people and also residents living in Qatar for more
Okay,
than
so
15
it's
years.
Qatar citizens and residents.
But more than 15 years in Qatar.
Okay. More than 15 years. So 15 years and older?
No, not older.
Ah,
They are
residents for more than 15 years. Okay. Than 15 years. Okay. So this is for Qatar. That's great. Then we move to UAE.
We also have some published data about risk assessment in Qatar related to some specific commodities like rice, leafy vegetables, and so on.
But you have the
They
consumption?
They have, but in brief, not detailed.
Ah.
Like the gram per day summary for this type of commodity.
So brief. Well, but
is it
where was it extracted
representative?
from?
Yeah, we need to check paper. It's
Ah,
different.
okay. Then I would
Paper by
not.
paper.
Yeah, I would not go there. So, okay, that's what we have here. So if I go to UAE now.
Yeah, I think that they did a survey in 2017, National Nutrition Survey.
2017.
Survey.
Okay.
Yeah, and currently they are collecting the data.
And when we say they, who would be they?
The Ministry of Health.
So it's Ministry of Health.
Because I am also on the committee of the strategic plan.
Okay. This is at the federal level, like at the national level. Okay. Okay. And the survey, like, was what was it like? Basically, is it 24-hour recall? Do we know like what type of methodology was used?
I don't think that they include the 24-hour report. They include the FFQ.
Okay. Oh, what did I do there? I think I did. So, okay. So methods, maybe FFQ. Okay. And if I go to Lebanon now.
We have done with the Lebanese food consumption survey for the age category 0-5.
So age 0 to 5.
Yeah, and we are validating a new food frequency questionnaire for the under 5. It's the first of its type and worldwide
FFQ
level.
under
Yeah,
5.
sorry about vegetables and fruits. Yeah, just download the report.
Okay.
The steps.
Okay.
Also 10, 19 years old
10 to 19 years old.
Adults,
Okay.
pregnant women, elderly.
Pregnant women and?
Elderly.
Okay.
We're still collecting now. We started the data collection 6-9 years old. Pending 6-9 years old.
6 pending, so it's
6-9.
6 to 9 years
But,
old.
no, it's يعني already are conducting them.
Okay. But you have the data available, like
Yeah, of course, grant
you do.
Yeah.
Okay, excellent.
I can add to this that personally I worked on a 3 risk assessment project
Okay.
where we developed the 3 FFQ, but not total diet study. We developed 1 FFQ for a time-based product, another one for rice, and a third one for spices and herbs. But for spices and herbs, it's like total diet study because almost most of the food contains spices and herbs.
Yeah, exactly. Yes,
Yeah,
yes. So that's what you did. Okay.
Also, there is milk intake. Andre.
Oh, milk intake.
Yeah.
Okay.
نجاة في لبنان، دكتور نجاة في لبنان مع دكتور لارا نصر الدين
فرح.
فرح ايه yeah, but mashallah she has lots of work done on food frequency in Lebanon and national surveys and stuff like that.
Yeah, maybe Dr. Maha can answer this.
Okay.
Yeah.
So
What is the question?
if I continue,
يعني,
then
is her data available?
No, it's up my data.
Oh, sorry, I'm sorry. Well, I'm sorry. I'm not trying to
We worked on this project for around 2 years ago. So we started doing this data
I met her
collection 1 year and
I met her once in Dubai, so I don't really know.
no, they collected the data, and the last one was in 2009 or 2014. The data that was explained by Dr. Lara and presented by Dr. Lara.
okay.
Study in Qatar, infant formula.
Infant formula study in Qatar. Is that what we're saying? In Qatar. So I'm going to put an additional point here for Qatar. We're saying infant formula study. Who is doing this?
We are doing this in collaboration with the nutrition.
So
Nutrition
Qatar
is
University?
taking- yeah.
Okay, Qatar University, but it's Qatar University
Qatar
project.
University.
Okay, perfect. So that's Lebanon. So if we move to Kuwait now.
Okay, so for Kuwait, they used to have the Kuwait National Survey, which is like a surveillance system that they have to do like every year.
Okay.
And they have data.
What do we call it? So national?
Kuwait National Survey.
So Kuwait National Survey.
Yeah, it's a part of surveillance system, so they have to do it like every year.
Okay.
But the thing is, they only used food frequency questionnaire, and they only collected few data points on adults and children based on adequacy of intake of various food groups. So it's the old system.
Okay.
So like how many fruits and vegetable servings, how many of milk serving. So it's not really comprehensive in any way, shape, or form. And it's stopped, and it keeps getting smaller and smaller by the year, amount of nutrition data they collect. And then there is a very old survey by KISR, the Kuwait Institute of Scientific Research, the National Nutrition Survey. It's for 2003. So that's not really recent. And most publications
2003, sorry.
on the Kuwaiti diet is on 2003.
Okay.
So it's really old. And then I've developed few, but in the process of publication. So yeah, I have some data.
You have some data as well.
Not so representative of Kuwait. So, because we do like hospital recruitment, and there is limitation of what kind of access to hospital you have, and every hospital represents a specific governorate, so it's not no way representative of the population.
Perfect. Thank
So
you.
that's the limitation.
Thank you. Not
We have a lot of data in the Arab region
Yeah.
that is not representative. If we want to collect them, it's a heavy work, but it's not representing the population. And we cannot say that in the Lebanese population, if 300% is eating from this, that mean representing Lebanon.
Yeah.
So that's
Of
why
course,
we
yes.
need the representative sample.
I see. Yes. Yeah, of course. Of course.
And to be honest, for example, the Arabic region, the Gulf region have gone through so many changes in the status
Of the population, of course.
So, we need to kind of
To update the information. Okay. So if we move to Palestine, I know our colleague from Palestine is not here, but we have some data.
Yeah, the West Bank.
Okay.
Palestine, the West Bank.
So Palestine, so we say West Bank.
It's called the first Palestinian National Health and Nutrition Survey.
So first Palestinian
National Health and Nutrition Survey.
National Health and
I think it's done in 2000.
National Health and
Adults.
Sorry, and National Health Survey
And Nutrition Survey.
Okay. And that was run when?
2000.
2000?
Yeah.
Wow. Okay.
3,620 participant adults.
Okay. Okay.
24-hour recall.
36,000? Oh. 3,000. So 3,600? Is that it?
No, it's not.
3,600. Okay. Sorry. Yes, I.
3,000 or 36,000?
No, 3,000. Sorry. Okay.
24-hour diet.
24-hour recall.
Yeah.
Okay.
In addition to a daily dairy intake of foods over 1 week.
Daily
I
dairy
think
intake.
It's food recall. Okay.
So it's daily dairy intake. The dairy? No.
No,
daily.
the daily. No.
Dietary
The
intake.
food recall for 7
Okay,
days.
dietary intake. Okay. Sorry.
Okay.
Okay. Anything else in Palestine?
Yeah, Gaza.
Okay, and then so then we have a Gaza.
دكتور, how do you recruit this يعني Palestine شلون من household to household؟ ما شاء الله.
It's a kind of study. I don't know how much it's for. Cross-sectional study.
So there is another study.
Yeah, it's a representative Gaza strips, representing Gaza. Adults. It was done in, I don't know, 24-hour recall.
24-hour recall.
2 non-consecutive days. It was.
2 non-consecutive days.
Yeah.
Okay.
3,000 participants.
3,000 participants.
Yeah. I'm checking the year.
Just to correct the Kuwait, the national surveillance, the annual surveillance system, the first one about yes.
This one?
Yes, it will be considered as annual surveillance.
Okay.
I said that.
I didn't write it. Sorry.
But actually, it's not. It's not. يعني they doing it, as I'm saying, the nutrition part is
2021.
so they get the growth.
21. 2021. 2021. Yeah.
Okay. Thank you for that. Then we're okay with Palestine, so we're moving to Jordan now.
It's based on household data collection.
So 24-hour recall.
Huda Huram.
Yeah.
The name of the survey, the name?
But it's not based on how. It's based on household. It's not individual. That's why we didn't mention it.
Okay, so it's household based,
Yeah,
not
it's household. She 2000. I think 2021. And they use the food frequency questionnaire and 24-hour report.
okay.
Really?
Okay. Sorry. FFQ and 24-hour recall. Okay. Okay then. This is, I think, well, thank you for that, because at least, this made...
This is for adults.
This is for adults
We will
only.
move to children and adolescents, and that's all.
This is for adults only,
We
right?
still have children. We have in Lebanon. We have already. This is the updated data in Lebanon, and also I think they did the study of Nahl to 20. I think in 2012. In 2009.
Where in Lebanon?
Lebanon. For
So
the children.
What is it about?
899
So,
participants.
children study on what? On honey? No.
No, children.
Oh, children. So children study. Okay, so 20.
No, it's a nahl, but it's not honey.
Oh, that's why it was.
It's abbreviation. Early
النحل.
life.
So that's why. I mean, I made the assumption. Nahl bees, so honey. No.
Yeah. I'm sorry for early life nutrition and health study.
What is it called? Sorry.
2012.
2012. Okay.
800 05
0 to 5 years
yeah,
old.
and 899 participant.
And 899 participants. That's, you know. Yeah.
We have in Saudi Arabia
As well.
yeah dietary intake of Saudi infant and preschool children by UNICEF in Riyadh.
School children.
Who is the lead researcher? You know?
I don't know. 849 participants.
And infants.
Yeah. Less than 5 years, 0 to 6 years.
There's 6 years. Okay, my understanding is that the
24
SFDA
hours.
has conducted also a food consumption survey, but I don't know to what extent it is available. So
Saudi FDA.
yeah, that's my understanding. But it is underway, I think, no? Dr. Salwa Al-Bar, I think, worked on that before she left for another academic appointment. But that was my understanding, is that was well underway. No? No? Okay. I thought that there was some data, like either available or ready to be available soon in Saudi Arabia.
No,
but
it's not. It's not. Definitely, it's not ready.
it's not ready. Okay. Okay. Okay, well, thank you very much for this. I know this took quite a bit of time.
Palestine.
Oh, Palestine, more information about Palestine? Yeah?
The last one.
Give me one
Palestine,
second, just to go here. Yeah?
West Bank.
So going back to West Bank here.
Yeah.
Yes.
2014.
So West Bank, 2014.
Yeah.
Yeah.
It's called health behavior in school aged children.
Behavior in school
Aged children.
age children. Yes.
1,900 participants.
1,900 participants. That's significant, yeah?
Age 11 to 16 years old.
11 to 16 years old.
They used 24-hour recall and they validated food frequency question. Done with the published data.
Done with?
With the published data.
Okay. Okay. Well, thank you for this. I guess right now, I'm seeing actually a number of next steps potentially, because I'm putting back the objectives, right, of the meeting to see if we have what are the opportunities and what would be the next steps. I think essentially the mapping that we did, even though it is cursory, needs to be better documented. So I see that as a potential most immediate next step. Okay. I see one also immediate next step to get this group together, or those of you who are willing to continue to work in this group with users of the data, such that you have an idea or a demonstration about how the data is used in terms of the type of templates, how do they extract the data, what type of data they need. I mean, just like what you do, I guess, Layal, in developing the risk assessments. And we could create a small group that would work on the development of these templates. Because at the end of the day, we want to have these templates ready so that even if we have some data that we identified, we can try to extract the information from there.
Okay, when you say templates, do you mean per exposure problem? What do you mean?
No,
because for example, dietary data, we are all very familiar, I think. Some level.
Dr. Dalal, we will be working on the template to include the consumption.
Okay.
The main things related to the consumption. So we will be doing the template, and then we will send it to you to start filling. If you have unpublished data and you have the consent to, it will be kind of Excel sheet that you will fill later on using the data extracted according to the headings.
It's a systematic way of collecting the data in a consistent way among countries. It's very
Just like actually we did for the occurrence.
And the spreadsheet that we enter the data in?
Yes, that's essentially what it is. And actually we try to see if it is also, there is a way even to extract the data directly or something. But anyway, having a common template, a common approach for the way the data is presented is going to be key.
I sent it to you now, if you want to check.
Yes.
But of course, we need to refine this data a little bit.
So I think actually that's the most immediate. I would see that as a most immediate next step. Depending on the...
It's good after developing it to share it among all members so they can add input or columns to be added based on their experience.
Yes.
So we agree on the template and then we start filling it out.
Yes, absolutely. And then the second step that I see is also, and here I'm thinking out loud, okay? We need to have a connection with the regulators of the region, you know, and because they are going to be at the end, ultimately, the users. Absolutely. And in fact, actually here, we can do it in either way. Either we manage to do this in the meantime, which is essentially between now and June, or we use the June meeting where most of the regulators are expected to be here. They are expected to be in Qatar as part of the third Codex colloquium that we are likely to organize. So see, on that part, you see, that's where the funding is used.
I think it's the other way around. I think once we secure the grants, then we contact the regulators. I think that's the best way, because there's no official way to tell those regulators that we are the lead on the project unless we have it going as a grant.
Yeah. Well, at this point, we're not actually talking about implementing anything per se. Right now, we are doing engagement with the regulators. So, and this is for what reason? Some regulators may already have projects underway. You know, they might have already activities underway. I mean, my understanding is that ONSA has an activity underway. I had some understanding that SFDA had some activity underway, and I don't know what it was.
This to me, you're throwing me under the bus.
Why?
Because that's what I'm telling you. With our government, we know how they think, how their mentality is. We have to be the lead on the project, then approach them rather than before we become the lead on the project, you give it to them. Because they can choose anyone else and take over the project on cost.
Well, no, because I mean, I'm sorry. Here, if you allow me, I mean, we're brainstorming here. No, of course. Yeah, of course, absolutely. And again, in this particular case, we're not creating ownership in any way. We're creating a network of experts.
Exactly.
Yes.
To be
even network of experts, the MOH will not allow it. They want to get all the credit to them.
Yeah, to be the lead, I want to know of course I want only just, maybe I will invite doctors from public health, I'm going to invite doctors from food science to have also their own projects.
Of course, yes.
But just to be able to become the team leader, I need to set it up myself and not have MOH give me direction on how to do it, because once you give them that, that's what they will do.
Well, but I think actually we're not even at the point where MOH will give us any direction at this point. You see, right now, if I take the authority in Kuwait, I mean, again, and here I'm still learning the system. So it's going to be, I guess, the new Public Health and Food and Nutrition Authority that is newly created, right? So when we say that we want to have a dialogue with the regulator, it's a dialogue at this point. So the dialogue, just like the dialogue that we just had, what do they have? Yes, with invitation, yes.
But we have like a common understanding, a memorandum or something between us and the Ministry of Health that there is also a joint project all the time. Right?
Right now, you have, yes.
So then I will bring that to the table as me. So they will respect that this is my boundaries. They will, of course, help me and do it with me. But if I bring it, if you do the opposite, whereby you approach them, they will say, "Oh no, we don't want Dr. Dalal on the project. We want Dr. So and so," just because.
Why they should remove your name?
Because they have the authority. They can.
The authority, but you are doing or proposing a proposal or submitting a proposal to be funded or within a group of scholars or researchers.
You can simplify.
We're talking.
Yeah.
We're having kind of يعني شوي صارت imagination of
not
things
imagination.
that are challenges or making challenges.
Yeah.
We need to do things that is the easiest possible.
Yes.
And why you should include, I didn't include the Ministry of Public Health in Lebanon to do the food consumption survey.
Yeah.
So why I need at this level to include the Ministry of Public Health? If you are able to do a project that is representing the food consumption data for Kuwait, why you should include authorities?
Because I need their ethical approval.
Okay. I'm thinking with you. I'm brainstorming with you. If you are aiming to do a food consumption data in a governorate, for example, so you should apply to your university ethical committee, or
no, just the Ministry of Health.
Okay.
The
so
university.
Did
only
you
if it's
work
in the
on this
university
before?
boundary. No.
Did you work on this before?
Yes, I did.
Okay, so it's doable.
It's doable. But if I'm gonna say, well, it's a nationally representative, and I'm gonna do, well, I need your collaboration. Well, I need dietitians from you to support me. Blah blah blah. Blah. It's gonna be a national representative. It's gonna be big. Well, I'll say, well, okay, so this is our project. It's not yours. We can say that. We have to tactfully take it. I want to be able to tactfully do it. I will provide you the representative sample. I will make sure it's a good probability. But tactfully, I have to do it my own way, not let someone dictate me how to do it. This is بعدين يصير I have no lead on the project.
I mean, I totally understand the concern. So, I mean, maybe actually then let's take a step back and we'll see how we're going to be engaging the regulators. I have to be also transparent with you. We will have to have an engagement with regulators, even if it means that. Yes.
But not at this point.
Well, but actually, we cannot postpone the engagement with regulators, even at the individual level, because the finality of the project is for regulatory use. That's the thing. And again, as long as we lay down the rules of engagement, and I'm being very transparent with you. I mean, we are involved in an activity that will have a regulatory use, a food regulatory use. And when I say a food regulatory use, whether it is by the regulator of the country or by somebody working in the discipline of food regulatory science. So not engaging with the regulator is not something that we can do. It's not a luxury, it's a must. And again, without taking, and nobody's dictating anything to anybody right now. In fact, actually, right now we are in fact-finding mode. We are in fact-finding mode. And in fact-finding mode, meaning right now, if we know that Qatar is doing a study, for example, and is investing in something, that is a very important piece of information that we need to take into account if we are to move forward with something. I'm taking this as an example. So that's why the engagement is more for fact-finding and developing the understanding. And then from there, we will develop any type of collaborative approach. In your case, Dr. Dalal, you already moved into part 3, which is we're implementing a study. We're not there yet. We're absolutely not there yet. We didn't even agree on a methodology. Right? We did not even agree on a methodology. We're going to be discussing this.
Yeah, but as a researcher, we need to know who is on the team.
And that I totally understand. And look, again, you will work with the limitations of what you have.
Even before deciding on launching a project for me, because I need to understand where
Absolutely.
I'm going and everything,
Yeah.
I need to map out this before.
Totally understand. And I guess, we will understand if you make a decision that, considers that the fact that you have limitations, and we will consider that absolutely. So
Absolutely.
I understand. I think that we're having like similar situation in Morocco, and but also we have a very nice successful story when we have implemented the national fortification program. So the success of it was because we have developed a very small committee with representatives from different stakeholders, and they were not feeling like they are invited to, but they were part of the project. So I understand all what was shared, but then once back to our homes and we start like discussing the feasibility of such a project, because even if I try to be like very enthusiastic about it, but the fact is this is a huge project, mostly if we don't have like the same type of data that is needed for to then when it becomes at national level, we definitely need more that's government in it, because it not only be about the owner, it is not only a matter of ownership, but because they have more facilities. If I consider a country like Morocco with such big population and a huge geographic area, and then I will need I need a huge team if I want to do it the way we are like perceive it. I'm not saying that it is impossible, but this should be taken into account. But my question now, what would the role of the legislators or like ONSA, for example, what is going to be their role in this? Because if I'm inviting people to join and to setting up like this kind of committee, one of the things is that everyone knows what's the input and what is expecting from him or from the institution he is representing. Thank you.
And I do not have a direct answer to your question, other than to say the first step is, and we need to know what ONSA is doing. If I take the example of ONSA, and the role will be different depending on where they are at. So if they are at the stage where they don't have any plans for food consumption, they do not have any data, so they will be completely at the receiving end. The discussion will be on how to collaborate so that they can be accessing that information and moving forward. Here I'm going to use the example of Oman, because we have some discussions underway with the Food Safety and Quality Center, and I had the privilege to meet now with Dr. Salima. So basically that discussion with the regulator will be, okay, what does the center has? What are their plans in order to basically fill the gap? And how do we then bridge that gap? If they are, on the other hand, completely in the way of they have already a plan, they have funding, they are implementing, well, how can we leverage what they are doing such that it is beneficial and we can use it as an example or potentially learn from it for the rest of the region? You see? So the role will be completely different depending on where the regulator is. So I don't have a standard answer. And that's why, going back to what Dr. Dalal's concern is, we cannot have the luxury to wait before engaging, because we have to engage. And this is a collaborative project. Basically, we cannot create silos. One of the reasons why we are at the stage where we are is because silos exist. And we need to, remove those silos without also diminishing all the concerns that you're mentioning. Those concerns are to be taken into account, but in order to move forward, we need to move in a collaborative way, going back to that end goal and managing our way through. That's essentially what it's going to be. We're going to be managing our way through step by step. So, inshallah. Exactly, inshallah. I think we've reached, I don't know, unless you have other comments, I'm seeing that people are leaving. So, we will have less people for lunch, I guess, eh?
They are waiting outside.
Oh, they're waiting outside. Okay, good. Any last comments that you would like to make? Well, concrete next steps right now is we're going to have actually, first of all, a reporting on what we discussed. Yeah. We're going to be working on this template to extract the data that exists. And I think that's going to be taking some time. Yeah. We're going to be actually connecting with some of the data users to contribute to the template, because I would not want to have a template done only, again, by a group of scientists versus another. We will need to bring the users and the generators, if you will, together. Then subsequently, we're going to try to plan. On the basis of that, we're going to plan the agenda of our next get-together, which is essentially planned for June. And that June meeting will involve regulators. So we will define the rules of engagement, inshallah, the rules of engagement with the regulators, and define essentially what will be our agenda for a workshop that we could organize in June. Hopefully. That's essentially an initial path forward.
Thank you for
Maha, if you want to have any final words.
I would like to thank you all for the valuable comments and for your input, and I'm waiting for your input concerning the documents sent already, and looking forward to see you all in June, inshallah.
Inshallah. Thank you so much for making yourselves available, and with this actually we conclude this meeting. Assalamu alaikum wa rahmatullah. Thank you.